like to call this meeting to order. The first order of business, board member meeting participation through electronic communications. Section 2.2-3708.1 of the Code of Virginia, 1950, as amended, permits members of the Board of Supervisors to participate in a meeting of the board through electronic communication means from a remote location in certain situations. Several board members have requested to participate remotely in the Montgomery County Board of Supervisors, Virginia meeting scheduled for Monday, May 11th, 2020 at 7:15 to be physically held at the Government Center, Christiansburg. The reason for the request is due to the ongoing state of emergency declared by the governor due to the COVID-19 pandemic. In order to comply with the governor's request to limit meetings to 10 people or less, in order to reduce the likelihood of spread, they would like to remotely participate in the meeting and will be participating remotely from their residence. Only members physically present can vote to agree to allow participation by other board members requesting to participate remotely. May I have a motion and a second?
Motion.
Second. Madam Secretary.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Vice Chair Bone?
Aye.
5 ayes.
Mr. Chair, at this point, we can move. I'd ask everyone to stand for a moment of silence, and then I'll lead everyone in the Pledge of Allegiance. Let us pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation,
One nation,
with liberty and justice for all. Thank you very much.
Okay, our first item is presentations, recognitions, and awards. And the first one up is New River Public Health Task Force.
Mr. Chair, we have Dr. Noel Bissell with us this evening. Dr. Bissell is joining us via Zoom. Noel, nice to have you with us. I'll turn the floor over to you.
Thanks, Craig. Can everybody hear me?
Yes, ma'am.
Okay, well, first off, I want to thank you all for your support, your tremendous support in the effort to deal with this pandemic in the New River Health District. Obviously, Montgomery County, Christiansburg, Blacksburg were very forward-thinking, very proactive in getting the task force going. And then obviously it became necessary to incorporate everyone because we knew this was going to be a regional effort. But I very much appreciate Montgomery County putting all the effort, the finances, and the work up front to get it started. We've been meeting pretty regularly, and we've gotten some things going that I think really are kind of some model practices for the state. Our initial goals were messaging, and our PIOs have done a fabulous job. We all know that we do not get consistent messaging from the federal or the state level, but I think we've tried to do and have been pretty successful at keeping our local messaging consistent, which is really important during this acute response and is going to be even more important as we look towards recovery and opening things back up. We wanted to do education, so we got a call center up and running. We wanted to protect our hospitals from the surge that could occur and overwhelm them. That's the biggest problem that we worry about in this pandemic, is overwhelming our medical resources. We were able to do that using our call center. And in the beginning, when we all know testing was really challenging and very difficult to come by, we were able to work with our worried well. We were able to talk to people about testing, educate them about the virus. And we're very fortunate that most people, 85 to 90% who are infected, are either asymptomatic with no symptoms or minimally symptomatic. and will recover just fine at home. So we were able to really protect our hospitals from that surge of people who wanted to get tested, who wanted to be checked out. People do very well recovering at home, and we haven't seen that problem. And that leaves our hospitals open to take care of the patients that are non-COVID patients that they still have to be in the community for. Our other big concern was our first responders, having those people available for the 911 phone calls. So we worked on getting those folks appropriate PPE, the protective equipment, and we've been really working on getting testing secured for them with a fairly rapid turnaround, because those are the folks that we need to make the decisions fairly quickly about who can stay on the job and who needs to be isolated, quarantined, or where we go. So when we got the call center up and running, we were protecting the hospitals from that surge, and we started really diligently working on getting testing. And again, because everyone with Montgomery County and the task force was so proactive, we were able to secure a lot of supplies and get things up and running, while a lot of folks in the state were kind of sitting back and waiting for things to come at them. So we were able to stand up our drive-through testing sites, again, keeping testing away from the hospitals. We've been doing that since March 31st. The first 2 weeks, we did 3 testings each week. And then since then, we have done 2 drive-through test sites weekly. In Montgomery County, we've been at the mall, and we've been at Blacksburg High School. We've been to Floyd County. We've been to Pulaski County. We've been to Giles County. And this coming Wednesday, we're also going to be going to the city of Radford. We have done well over 2,000 tests. If you are looking by zip code on the website, it is misleading because they are not incorporating the results that we're getting from our partnership with Fralin. We've sent almost 1,000 tests alone over to Fralin between us and Roanoke, and those are not on there because they're not part of the electronic reporting. So if you're looking on the zip code, it's very misleading. But in the New River Health District, we have done over 2,000 tests. The drive-throughs, I don't know if anybody's been through them or has seen them. They go very seamlessly. They're very efficient. It's wonderful to see people from all of our localities out there. We have law enforcement from all of our localities, which again is just that message that we are unified as a community, which is critical in facing this response. I will say that even with increased testing, we knew we would see an increase in our cases, but we're still staying right around 4.5% positive. So, and that's a good thing. And again, our hospital resources are actually underwhelmed and not overwhelmed. So I think we're at a point, we are testing much more broadly than most localities. We are testing asymptomatic, we're testing community members, we're testing contacts. So I think we have a really good picture of what's happening in our community right now. And we do see our cases creep up, but you know, as people talk about flattening the curve, we haven't seen that exponential rise that we worry about. And I think, you know, we have the testing available. We've done very well with our messaging. I think we've done a really good job with our epidemiologists in taking those positives, doing the contact tracing and mitigating so that we're able to isolate and contain when we do have outbreak situations. So, I think we're doing really well there. And any part of emergency preparedness, recovery has to be involved in your response plan. And that's where we're really starting to focus now. We realize how dependent our economies are on our student populations. And so we've been very active in preparing and having a plan for how we could protect our vulnerable populations and still bring our students back. And that's what we're actively working on right now with each university, looking first at their athletes and then bringing their students back in phases. Fralin, which is our partnership with the Biomedical Research Lab, they are ramping up their ability to test, and they'll be up to a capacity of about 1,000 tests a day. So when the students come back, we'll be able to do that surveillance testing. And I think we'll be able to do the contact tracing that we need to continue to mitigate the spread. We have 3 to 4 full-time people right now that are working on that. The work is steady. It's certainly not overwhelming, but we also have our Medical Reserve Corps and an epi response team. They have been trained in contact tracing, and they've gotten the training online specific for COVID, so we can call on them as we need as well in the future. So we're looking at that as we move into the summer and we start to open up our economy and we start to look at trying to bring our students back. I mean, the reality is our students are not our big concern as far as having increased cases. We know when they come back, we'll have increased cases, but we have to, the big concern is not overwhelming our healthcare resources, and that's going to be more our vulnerable populations, which is our older population, those with chronic conditions, our nursing home facilities, our jails, our mental health. So we're looking at specific measures that we can continue to keep in place even as we start to open up our businesses and our restaurants to protect those folks. You know, continuing with some of the early opening for our seniors, or those early hours being just for our vulnerable populations, special seating in restaurants or early dining hours, those kinds of things. And then we really have to work on the messaging. The first thing we have to work on is, and all of our localities have been very supportive, that we want to welcome our students back. We want them back. That we know COVID did not come into the New River Valley just with our students. There were lots of other portals of entry. That we do know that if we bring a huge percentage of our population back, that we will see an increase in cases, but we're able to handle that with what we have in place. And again, they're a younger population. We're doing active work right now with our nursing facilities. We're actively working with our jails. We're working with all of our first responders. We're working with our mental health folks, again, to get that testing, those test results back, the isolation, the contact tracing. So we've been really working on putting this all together. And then earlier today, we had a call with some of our legislators. We've had visits by Morgan Griffith and Nick Rush to our testing sites to go back to Richmond to kind of give them the message that what we're doing here in Southwest Virginia and what the current situation is in Southwest Virginia is very different than what they're seeing in Richmond or Northern Virginia or the eastern side of the state. So, you know, I think we have a good plan. We're being very proactive. I think we're anticipating and kind of putting things into place. We've got Kevin Bird and the Regional Commission helping us with engaging our small businesses. Our Onward NRV is helping with our industry, our manufacturing, and our IT sector. And everybody's coming together and putting their plans into place, looking at what practices are out there and trying to figure out how we can all work together to do this in the New River Valley. And, you know, I'm pretty excited that we're in a pretty good position looking at where other folks are in the state right now.
Okay, thank you. Thank you, Doctor. We appreciate that. Well, I'm sure we'll probably have some questions for you if you don't mind.
Sure, not a problem.
Okay. Supervisor Blevins, do you have any questions for Dr. Bissell?
Yes. So your opinion in the task force that we are in the phase of recovery, are we moving towards that, or are we ready to call it recovery?
So we are in our active response right now, but recovery is part of that. And we are definitely looking towards recovery because we haven't seen that huge, that exponential rise in cases. We've had kind of a smoldering situation. We certainly do not have an overwhelming need or an overwhelming response on our healthcare, our demand on our healthcare system. When the governor put the measures in place, the social distancing, the stay-at-home order, if you look at the CDC mitigation levels, that was well in advance of where we were for needing it, but I think it helped us. It helped us keep it under control, and it helped us stay at a very low level of disease prevalence. But now that we're looking at reopening, we definitely need to look at how we can do that and still be safe and be very proactive about doing it. And that's what a lot of our time is spent on right now, because we are actively testing. And even with our testing, we have not seen a surge in cases. It's been a very manageable caseload. and we are staying very consistently at 4.5%. So we have to start planning for the future, because we know that's going to change when we bring a significant number of students and increase our population, significantly. That's the unique thing about a university community, is that the students coming back is going to increase the population considerably.
And as we move towards this reopening and recovery phase, and our students start coming back, and people start getting out to retail stores, and they'll be more comfortable and confident going to the emergency room. I've heard a lot of the rescue squad say some of their calls, 911 calls are down. People, I've heard the hospital say some of their people coming to the hospital where they might have chest pain. They may say, well, it's not that bad. They're fearful of catching COVID for the emergency. Are we in a good, do we have the capacity that once people become comfortable and confident to handle possible surge, because as more population is out and we do more testing, obviously we're going to find probably more cases, and with the return of the general traffic, hospital traffic, are we able to do that?
So right now, yes, our hospitals are well below their capacity. They both have pretty detailed plans about how they could surge to over 120% of capacity. If you look at statewide, even the areas that are hardest hit right now, bed capacity has not been exceeded, and the ventilator capacity has not gone, the use of ventilators has not gone above 21%. So, statewide, things are still looking okay. And certainly in the New River Valley, both hospitals are well below capacity and have pretty detailed plans to go up to a surge of about 120%. You're absolutely right. People are delaying care, and that's part of our messaging right now, is to let them know the hospitals are safe to come to, and we want them to come when they have chest pain. We want them to come if they have stroke symptoms, if they're having severe abdominal pain and vomiting, because they have seen where the people are presenting a little bit later. And this is one of those where you have to be careful of what the trade-off is. Other thing I would say is that from a mental health standpoint, we're seeing a significant increase in those issues. People who have depression, anxiety, one of the worst things you can do is socially isolate them. And yet that's what we're telling everyone to do, is to socially distance each other. Our child abuse cases, our child molestation, teen pregnancies, sexually transmitted infections, all of those things, suicide attempts and suicide completions, those things we're seeing a rise in, overdoses. So it is very important that we reach those folks and let them know that there is available care, that we are here to take care of them, that the resources are here. And we will continue to watch our cases as we open up the economy, as we bring the students back. The hospitals are starting to ramp up their elective procedures. And that's one of those things where you can scale it according to the need that you have. And we can scale our testing to the need that we have. So if we really need to ramp up testing, which we know we will have to when the students come back, we have the ability to do that. We have the lab capacity to do that. And with our epi response team, I think we have the human resources to do that as well. The nice thing is, again, that with the students coming back, they're very unlikely to overwhelm our healthcare resources. They're not going to be the ones, for the most part. I mean, there will be those one-offs and those occasional ones, but for the most part, the students are young and healthy, and they are not going to need the intensive medical care that we worry about in our long-term care, nursing home, high-risk populations. So those are the ones that we're really, really focused on protecting those vulnerable populations.
And as we're focused on that, especially for our nursing homes, what type of steps can if you have a nursing home, do they have the availability to come to testing sites or ways to help supply, or what are we doing in task force help time needs? And not only for the most at risk, but also for some of our essential workers and childcare that as they're essential, but as people start going back to work, they're going to need, be able to still provide those services.
So we are, with the nursing home specifically, we have been working in tandem with Carillion and with Lewis Gale to reach out to them about the whole response. We've worked with them about getting appropriate PPE. We've worked with them about getting their staff fit tested for the appropriate N95 masks. We've worked with them about teaching them proper doffing and donning of PPE so that they avoid cross-contamination. We have a plan now before patients get discharged from the hospital or admitting into the nursing home. They have a test that's done. And then on day 5, they get another test that's done as well. During those 5 days, they have them in a quarantine situation. And we're trying our best to keep them from being introduced into the general population. We're also offering them that we can come in and do just some surveillance with their staff. And again, education with the staff to make sure, because that's a big concern, is if the staff is going to introduce it into the facility. So good hand hygiene, good respiratory hygiene, using their personal protective equipment, because the current guidance is, and the current data shows that if they're using the appropriate PPE, that it's very unlikely for them to be infected by a patient or for them to infect a patient. So we're actively working on those relationships. We're actively doing a lot of the testing through Fralin. We also send some of the tests through Labcorp if we need to, and working on education. And the nursing homes have been challenging because obviously they know that they're a target and they're somewhat closed, and we've really tried to reach out and build those relationships. You know, as far as other facilities, I know you mentioned in their childcare. We are starting to reach out to some of our employers just in general to offer testing. You know, most of the childcare places right now are closed, but we can certainly offer testing in those kinds of facilities. Really, you know, again, testing is one point in time, so it's not something where you need to test everyone, but you want to go in and maybe do some surveillance testing of your staff in there to look for that asymptomatic carriage. We really need to emphasize personal responsibility for community health, and that if someone is ill or has been around someone who's ill, they really need to not be going to work. You know, they really need to be not going out in public. And then we do some of the surveillance testing as we can. And again, it's about testing and identifying those positives, doing the contact tracing, and then mitigating the spread. It's all about mitigation of risk. We're not going to eliminate risk. We're going to see cases in these different places. And what we need to do is mitigate that risk and do our best. And that's going to be with education and messaging about personal responsibility. It's going to be with offering testing and guidance, and then doing the contact tracing and making the recommendations. With our businesses, in most cases, if they have a positive case in the business, it doesn't mean that they have to totally shut down. You know, it means that we can work things out to help them mitigate the effect on their business practices, and go from there.
Can you explain a little bit, that kind of went into one of my questions about contact tracing. And so if you are a small business owner and you have 4 or 5 employees, and all of a sudden somebody tests your employee test is positive, well, then, and you do the contact tracing, that business has to, for personal responsibility, close down, disinfected, do all the cautionary measures. That's something that small business owners will need to look at as well, correct?
Yeah, and actually, you know, one of the things that the task force is working on is a continuity kind of team for our businesses for that exact thing, that we have an environmental services component that can come in and do the deep cleaning according to the CDC guidelines and recommendations with the appropriate products and EPA products and in the appropriate concentrations. If it is a small business where people are in very close contact, we probably would test everyone there. You know, we would make the recommendations as far as personal protective equipment, masking, making sure that there's appropriate hand washing. Can they, is there any way for them to distance? Is there any way for them to stagger things? And then we go from there. A small business, obviously, it is a lot harder if it's a very close quarters with just a few employees than it is in a bigger business where you might be able to address in one area and keep it from spreading to the other one. But for confidence, for the business owners, for the patrons, for the employees, we would have this business continuity group that involves the recommendations, the testing, getting the results, making recommendations, giving guidance, and just basically checking off that this person, this business owner, is doing everything according to plan. Someone mentioned it as destigmatizing it, because COVID is out there. We have to live in a COVID world. It's not going to go away. So we need to learn to live and to operate in a COVID world. And, all we can do is our best to protect those businesses and help with the optics to protect their reputation so they don't go under because of something like this. Because despite all precautions and everyone doing their best, it's really hard to contain something where you have a fair number of people that are asymptomatic who are spreading the disease and just don't even know it. I mean, we do the screenings for temperatures, we do the screenings for being ill, we do the screenings for contact with ill people, but there are still a fair number of people out there who are not symptomatic. And that's where we really just have to continue to focus on the hand washing, the respiratory hygiene, wiping surfaces down, which we've gotten very, very lax on. We've gotten very complacent. So we need to kind of reset to some of those basic precautions.
I just wanted to say thank you for your service and leadership for our community. You've done a great job. It's very remarkable collaboration with everybody working together. Thank you.
Thank you.
Okay, Supervisor King, do you have any questions for the doctor?
At this time, Supervisor Blake has asked a few of them, and I do appreciate that.
Okay, I take that as a no. My audio isn't working as well as it was last time. Supervisor DeMotts, do you have any questions?
I just have one question, and just kind of to follow up from what you were saying, Dr. Bissell, that we're doing a lot of testing. We're able to process some of those tests through the Fralin Center in Roanoke. What's the timeline from somebody getting a test to knowing the results of that test?
So our goal is 24 to 48 hours. Fralin has done pretty well with that. I won't say it hasn't been without some glitches, because they are a research lab that transitioned to clinical. So some of it is getting the whole data entry and processing. So we're working on that. We're also using LabCorp, which is a commercial lab. And the turnaround on that is also right now running at 24 to 48 hours. So we're trying to balance that. Obviously, the more testing you do, the more tests that the lab gets, and their turnaround time tends to go up. And Fralin's kind of feeling things out. So some of our results have been delayed a couple of days with Fralin, but they've gotten just effective today. They have 3 new machines. They got some money from Go Virginia to hire people to really increase their capacity to 7 days a week, which will be huge. Our biggest delays have been over the weekend, where people haven't been there processing. During the week, if we submit a test one day, usually by the end of the business day, the following day, we do have the result. Fralin runs a really good test, and they don't do everything automated. They have a significant human component, and that gives us a more reliable test than something that's automated the whole time, or all the way through the steps. And so the test itself at Fralin takes about 9 hours from the time they get it and start processing it until they can result it.
Thank you. I think that's really great to know, because I know when the pandemic began, there was a huge lag in testing from the time of test till the time that we had the results. I think that probably makes your efforts at contact tracing much more challenging. And then also as we look to bring the students back for classes in the communities, I think knowing that we can rapidly get test results is extremely important.
Yes, absolutely.
To say thank you to you and to all of the members that have been serving on the task force, representing across that section of, all of the business interests, government interests, our first responders. It has been very, very important to the community, to the whole region. The models that this task force has put forward in terms of sending out messaging, coordinated messaging, so it's coming from all the localities and we're hearing the same messages. I think that has been very beneficial to the whole region because there's not a lot of confusion. There's not a lot of different messages coming from different fragments of the population. So thank you very much for everything that you and the entire task force have done.
Thank you.
Okay, Supervisor Biggs.
Oh, hey, Dr. Bissell. I also want to compliment your leadership and the task force members. I think we are here today where we are because of everything that you all did from the very get-go, and that's why we've become a model for the state. Supervisor Blevins asked some of my questions, but I want to know, like right now, when the governor had his press conference today, he said everything was on track to open May 15th, except Northern Virginia needing more time because of the increase of cases they have. So our task force, are you all feeling that we're on track with everything that you feel we need to have in place that we'll be okay for opening May 15th also for phase 1 if that goes through?
I think we are very comfortable with it. Again, the number of cases we're seeing and the percent positive. When we started testing, had we seen a huge increase in the percent positive, I would have been more concerned. But our tests, no matter how many tests we're doing, if we're doing a couple of hundred tests a week versus in the very beginning, we were doing 10 tests a week, we're still at that 4.5% positive. So I think we have a very good idea of where the disease is in our community right now. And again, that's where we are right now, recognizing that as we open up and as we bring students back, we will see an increase in cases and probably an increase in that percent positivity. But when you look at the Northern Virginia area, their percent positivity is extremely high. I mean, it's 20-some percent, 30%, depending on where you look, because they have so much more disease in the community. So I feel pretty good about where we are with our disease prevalence. I think a key thing right now is messaging about that personal responsibility for our community's health. I mean, we really take pride in our individual rights in this country. We've kind of gotten a little bit away from those responsibilities that go with those rights. And fighting this pandemic has to have everyone's buy-in. And it's a change. And we all know how behavioral change is challenging, but we have to ask everyone to do their part. And that's got to be the messaging moving forward to keep our numbers where we are.
Right. I agree with that because I've had a lot of people say to me they've gone to different places like grocery stores and not everyone's wearing masks. And as we begin to open up, another question I have is, let's say I'm a salon owner and I want to open up, but like I haven't had a test. I don't want to open up and not know if I have it or not. Employers and employees that would feel comfortable having a test, is there a way they can get a test before they open, or are they just going to go out and open?
So right now, we've pretty much opened our testing that anybody who calls our call center can get a test. And we are working with employers if they would like us to come out and do testing at their facility, we can do that. We have to just remember that a test is one point in time. And so, I could test somebody today and they have no virus today, but they could go anywhere and get exposed. And in the next couple of days, even by the time they open up, they might be exposed and then be positive. So we just have to remember that that test is one point in time. We're looking at antibody testing, both through the finger stick and what we call ELISA testing. There's a lot that we're doing to try and kind of put the whole picture together, because this virus does not behave like a typical infection. There's a lot of unusual ways in which it's behaving, and we're piecing that together. Testing has a lot of value in determining the prevalence of disease and kind of how we are going to formulate our plan for doing surveillance and contact tracing. But this is, again, where we have to focus on that messaging of that individual responsibility. If someone is really attentive to washing their hands, not touching their face, wearing a mask to protect other people from them, wiping down surfaces, coughing into their arm as opposed to just coughing in the open air, those kinds of things make a huge difference. And we got very, very complacent with them. So the messaging has to be that this battle is everybody's responsibility, not just public health, not just local government, not just law enforcement or the healthcare sector. It's everybody's personal responsibility.
Okay. Well, I feel a lot better hearing that. And it sounds like we're all on board with the May 15th, phase 1 part of it. And my other concerns, I think have been brought up before, like, about, if we have a surge, will we be prepared? And it sounds like everything is in place for that right now. And it sounds like you all will be constantly monitoring the data as we open up with phase 1. Is that correct?
Absolutely.
Thank you so much. Really appreciate it.
Thank you.
Okay, how about Supervisor Shepherd? Do you have any questions?
I did have just one, and I don't know that there's an answer for it yet. I was wondering about at the university level, when they come back, will the infirmary do the testing, or will they do testing and on the university site somewhere? And is there any talk or thoughts this early about what to do if someone is tested positive on the university?
So we're working with both Shepherd Health Center at Virginia Tech and the Student Health Center at Radford University so that we have a coordinated effort about testing. Again, testing is one point in time. So I don't really see any need for the entire population to be tested before they come back. What we need to do is surveillance testing and kind of monitor where things are. So my epidemiologist has kind of come up with a plan where we would do surveillance and we would spot test several hundred students every week. Our athletics teams, we would do surveillance on them a lot more frequently just because they'll be traveling and they'll have higher levels of exposure. The whole thing about bringing Fralin up and running and getting them to 1,000 tests a day was that we could use them, and that once they get all the glitches worked out and they're at that 1,000 tests a day capacity, we would have that 24-hour turnaround. We are working with the universities. A large portion of the students live off campus. If they need to self-isolate or self-quarantine, that would be the health department following up with them and giving them guidelines. For those that are on campus, we've talked to them about having designated housing so that they would be able to do that quarantine and isolation. So that's part of the discussion right now is how we put those plans into place to do that surveillance and then follow through on those recommendations. I will say one of our first cases, actually the first case that we reported in the district, was a student who did return from travel at spring break. It was a Radford University student. She developed symptoms and was very concerned that it could be this, and she did all of the appropriate things. She called us, she got tested. We told her she needed to self-isolate, and she absolutely did that. She was really good about self-isolating, and her friends brought her meals, and we had no further complications from her case. We had no other infections that stemmed from her case. So that's, again, the messaging of that personal responsibility. That's that follow-up, and then it's going to be working with Virginia Tech, with the Student Health Center, with Radford, the Student Health Center, and also working with their Dean of Students offices. If we do have to put someone in isolation or quarantine, we have to make sure that there's someone who can deliver meals to them, who can do the errands and things that they need to have done. And both Dean of Students offices are very active and engaged in working out plans for that.
Very good. Thank you. And I want to say I appreciate everything that you and the task force have done. I believe you've done a great job. Thank you.
Thank you.
Okay, Vice Chair Bond.
Dr. Bissell, could you tell us the telephone number and website if somebody wants to get a test?
Oh, I have to look that one up. I don't have it memorized. Hold on.
While you're looking it up, could you tell us how long we are going to have to be personally responsible with the face mask, cleaning surfaces, and all those things that you itemize? What phase or at what time in the future, or has our future completely changed at this point?
So I think our future has completely changed. We need a collective reset. COVID's not going away anytime soon. And with globalization, with international travel, with zoonotic diseases that can jump species from animals to humans, there will be another one that takes its place when this one kind of gets to where flu is, that we have a vaccine and we have, you know, it becomes part of the pattern. So, you know, we got very, very complacent in our infection control and prevention. And we have public health studies that show that people wash their hands maybe 20% of the time that they should. And it's really very unfortunate how complacent we got. You know, coughing or sneezing into the open air, a significant number of people do that. So while I don't think that we're at the point about permanently that we would have to wear masks out in public, I do think that at least we're talking the next year to 18 months that we're going to be dealing with COVID until we can get a vaccine or we get enough people that have been infected to have some good herd immunity. That's not going to happen overnight. But then I do think that it would be very reasonable to kind of keep the whole mask thing. If people are ill and they go out, that they wear a mask, again, to protect other people from them. You know, and again, just focusing on that personal responsibility about hand washing and good respiratory hygiene. I think we do need a collective reset there, and I'm hoping that that's one of the messages that comes out of this. The call center phone number is 540-267-8240.
Could you say that again, please?
540-267-8240.
Do you have a website, or do people have to call in?
So the best thing is to call in, and that's how we get them tested. Because we put it in the computer and we schedule the appointments that way.
Perfect. Could you tell us how often we are supposed to wash our hands?
Multiple times a day. We should be washing our hands before we eat anything. We should be washing our hands after using the restroom. Anytime you're out and about and you come back in, you should wash your hands. If you've been doing a lot around the house or in the yard, you want to be washing your hands. And people just don't do that. I mean, again, we have studies that people wash their hands less than 20% of the time after using the restroom, or less than 20% of the time before they eat. Do they wash their hands? You know, touching our face, everybody touches their face, and we're not going to totally get rid of that, but we have again people touch their face hundreds of times a day, and it's a conscious behavioral change that you really need to say, I'm going to work on not touching my face, and figure out if there are reasons that you do touch your face. Is your hair falling in your face? You know, should you wear something to pull your hair back? Are you wearing glasses and having to constantly readjust them? Do they need to be adjusted so that you don't need to do that? It is a very challenging behavioral change, but if you touch your face several hundred times a day and you even cut that in half, you've reduced your risk of infection by a significant percentage. So there's a lot of behavioral things, and we all know behavioral change is really hard.
Are there enough PPE for essential workers? And if so, or if not, where do they get some? The N95 versus perhaps the masks that people are making, like the ones people get from NRV mask makers.
So we're in pretty close touch with our EMS, our nursing facilities, and our hospitals, and they're monitoring their PPE supply pretty regularly. The PPE supply is starting to open up. The other thing is actually now on Virginia Tech's campus is the Battelle reprocessing unit, that N95s. You know, so traditionally N95s have been, you wear it once and you throw it away. And now you can re-wear it multiple times and it can be reprocessed. So you can get about 25 uses out of it before you have to dispose of it. So we've extended the life of the PPE that we have, which is buying time. And then the PPE chain is opening up. So looking at the VHHA website, they kind of keep track of hospitals that are feeling like they might be in a PPE crisis. And early on, that was in the 6 to 8 to 10 range. And now on any given day, it's literally 1. And so VHHA has had this coordinated response with VDEM, the Department of Emergency Management, to make sure that when we do get PPE, it gets funneled to the places. They track PPE burn and usage, and that all gets submitted up through the chain to VHHA and VDEM. And that way they know where the resources need to go as they come in.
Are our businesses well informed as to what they need to do to open?
So we just released last week, a group of, Kevin Bird led the group for the small businesses and our retail businesses, and they released a plan, which we actually released it before the governor came out with his recommendations. And it goes into much more depth about a lot of the things you're talking about employees wearing masks, about hand washing, about staggering shifts, about disinfecting, about appropriate social distancing. And that's been, my understanding is that has been very well received from our businesses, that they do feel like someone is looking out for them and giving them that guidance using this document.
And if they haven't received it for some reason, where would they go to get it?
So Kevin Bird and the regional commission are the ones who kind of put it together in conjunction with tourism and our small business association. So where it actually is located, I would have to find out. I know Kevin sent a copy to everyone on the task force. So we all have a copy if anybody needs it, but our chambers of commerce, our tourism folks, and our small business association all worked on it. So any of those contacts should have access to it as well.
I have a couple more minutes, so I'm going to take it. Where are most of the cases coming from?
Did you say where?
Yes. What portion of the population is having the most cases?
So we have a pretty a wide range. Montgomery County has the most cases in the district. They have close to 70. We have very few young people. Our 10 to 19 range, we have a pretty significant number. You know, I would say 10 to 19, 20 to 29, 30 to 39. And then our middle-aged folks, and then it trails off again with our older population. You know, if you look at hospitalizations, we've only had about 12 in the district, but our hospitalizations have been in the 40 to 49 age and the 50 to 59 age for the most part. So the very young and the very old are not a significant portion of them. It's definitely more of the young adults and the middle-aged adults.
That's all my questions. Thank you so much. Your leadership has been outstanding, as well as the task force and all of the essential workers. Thank you.
Thank you.
Dr. Bissell, I just have one question, basically. I listened to the governor's briefing today, and he mentioned that Northern Virginia, their positive rate is about 25%. And you say ours is about 4.5%. And I think he said that the rest of Virginia is around 10%.
Yeah.
Do you think that or the fact that we haven't had a steep rise in the curve is related to the number of folks out there that have already have antibodies or already have been exposed or had it and gotten over it?
I mean, I think that is part of it. I think through the antibody testing we're doing, we are definitely seeing that it was here before people said it was here, and we just didn't have the testing. I think the bigger part of it is that when the governor implemented the social distancing, the limitations and restrictions all the way up to the stay-at-home order, we did not have a substantial disease burden. So I think we really kept our numbers low by doing those things, and giving it that attention. And then the other part of it too is again, a lot of our population is not here right now, in that the students are not here. So I think the biggest benefit was his early stay-at-home order. The northern part of the state, Richmond and the Eastern Shore, they were already knee deep in it. So you would expect, because you have to look at what's happening today is really kind of what measures were in place 2 weeks ago. So when he took those measures, we did not have a significant disease burden. So moving forward, we were able to control our cases. When you look at Northern Virginia, Richmond, and the Eastern Shore, when he put those orders into place, what was happening 2 weeks prior to that, they were still going to get a substantial rise in their cases.
Okay, well, thank you. Is there any follow-up questions for Dr. Bissell? I'm not hearing any. So thank you, Dr. Bissell. I have been to your test sites probably more than I really wanted to, but I got to say they run very well, and I have to second your leadership. It is you have done just an amazing job, and you've pulled together a good crew, and we appreciate all that you do for our county. Thank you very much.
Thank you for your support and all of the logistics folks. The task force has made it very, very easy to do.
Thank you, Dr. Bissell.
Okay, well, have a great night. Thank you.
Thank you.
Mr. Chair, our next item under presentations, recognitions, and awards is the report from the broadband assessment that we had recently completed. Representatives Eric Price from Thompson and Litton, and Bob Peakey and Skip Skinner from Blue Ridge Advisory Services Group are going to provide an update to us this evening on the broadband assessment. And I see Brian Hamilton is listening in, and Kevin Bird as well. They were integral parts of the team. So, gentlemen, I'll turn it over to you.
Good evening, Mr. Chairman and members of the board. Kevin Bird here with the New River Valley Regional Commission. And before I turn it over to the consultants, I was going to offer up a little bit of context here that led to the presentation this evening. So overview of our process and planning to date. As you all are aware, this is a project that was partially funded by Virginia Department of Housing and Community Development, utilizing their community development block grant funds. As a part of the community development block grant process, they highly encourage the best practice of putting together a management team to help inform and advise the planning process throughout. This project had a project management team that was assembled. It comprised close to 20 individuals from the county, the 2 towns of Blacksburg and Christiansburg, city of Radford, as well as representation from K through 12 and higher education, and some larger employers and general citizens. They have met twice at kickoff and somewhat forming the planning process, as well as recently to review the plan that you are receiving this evening. The Regional Commission assisted with the request for proposal process and selecting the consultants. We helped prepare the draft and then worked alongside county leadership and a few members of that project management team to select the consultants for the process. The Regional Commission also prepared a community survey that was distributed, made available online as well as hard copy through all of the libraries within the county, and just really great support from the library system in notifying us when surveys were completed and when they needed to be replenished as well. So we had really good results that I think the consultants found useful in their process. So now I'm going to go ahead and turn it over to the consultant team with Blue Ridge Advisory Services and Thompson and Litton for their presentation.
Okay, so Kevin, is it okay if I take over the screen?
Yes, I believe that's the case.
Can everybody see the presentation at this point?
No.
Okay. I wonder if whoever's controlling the meeting has to relinquish.
We're gonna check and see, Bob. Hang on.
Do you have a copy of the presentation, whoever's driving the meeting from your side?
We have it, it's in their agenda
Yeah.
packets, so they have it. There you go, it's coming up.
There you go.
Excellent. Operator error, I'm sure.
We got it.
All right, well, perfect. This is Eric Price. Again, we really appreciate the opportunity to work with Montgomery County and the city of Radford and the towns of Christiansburg and Blacksburg. This report pretty much summarizes all of our findings. We started this project back in August, so we've got about 10 months worth now. Had several meetings, but I think this report will be very informative. Of course, we'll be ready to answer questions at the end. For the agenda, just want to look at the agenda items. So the goal tonight, and we're going to go through this as quickly as you want us to, but we're again here to answer and to do anything as far as that you need of us. But we'll review the unserved and underserved communities. We'll look at the ranking model assumptions. We'll look at the rankings, discuss the recommendations that our team has made both to the management team and ultimately to the Montgomery County Board, look at next steps, and then provide you with a milestone update. So Bob, if you want to take it from there, or Skip.
Well, good evening, everyone. This is Skip Skinner with Blue Ridge. It's very good to be with you this evening. Glad we have an opportunity to talk with you, even though it is a virtual conference. But we just want to kind of reinforce some of the things we talked about at the meeting back in December. But we identified a number of communities that were either unserved or underserved in the county, including the 12 areas that we have listed on the screen here. These are in alphabetical order, but if you start in the northern portion of the county, it includes McDonald's Mill, Tom's Creek, which was actually a little bit surprising to us being so close to Blacksburg, North Run and McCoy, Walton, which is adjacent, of course, to Radford, Park Street, South Franklin, Woodland Drive, all nearby, as well as Fairview Street near Christiansburg. And then if you get more in the southern and southeastern portion of the county, you see Sugar Grove, Shawsville, Allegheny Springs, and we've identified approximately 3,105 households that we consider to be unserved. And if you look at nationally, we consider an average number of households nationally being about 6%, but what we found in Montgomery County, again, a little bit surprising to us just because of the university and the technology available at the university, but in Montgomery County and Radford, we've determined that percentage is approximately 7.6% as opposed to 6% nationally. So, and this is a map showing those communities. One of the things I'd like to reinforce here is the consulting team is confident that we've not identified each and every individual household. If you look at all households, if you look at all the communities, there's actually 41 communities, including the 13 areas that we have here. There's another 29 areas that we consider to be underserved, but we don't want to imply that we've identified each and every household unserved, but we are confident that we have identified the majority of those needs that currently exist in Montgomery County and Radford. Here's a list of the underserved communities, including the 29 areas. Blacksburg Country Club, Belmont, Childress Road near Radford, Dry Valley, Elliott Valley. If you get over in the eastern part of the county, around Elliston, then you go down to Goldberg Estates, Indian Valley, Lafayette, Longshot. You continue to the next page. You see Peppers Ferry Road, which is more of a corridor, if you will. Pilot, Plum Creek, Preston Forest, again adjacent to Blacksburg. Prices Fork is another one of those corridors along Prices Fork Road. The Reiner community in the southern portion of the county. Rogers, just south of Christiansburg, Gorge, Sealoo, Smith Creek, Union Valley, Vicker, Wake Forest, Whitehorn, Woodland Hills. And again, when you look at these 29 areas, it was approximately 5,933 households. And again, here's more of a graphic illustration of where those communities exist throughout the county. And again, these are what we classify as underserved, which for our purposes is somewhere in between 10 megs and 25 megs, which is the FCC definition of broadband today. 2510 rather, 25 down, 10 up. If you look at the underserved communities, we consider that the unserved communities rather, those are the communities that even fall below that threshold. You've got a lot of issues with availability, pricing. Those things also come into play. Next slide.
So this is Bob Peakey. And Supervisors Bone and Christiansburg were involved in the management presentation last week, so they're well aware of why we have these imprimaturs on this slide. I think some of the people on the management team who lived in some outlying areas realize there's a real shortage of service, but we seem to identify very discrete communities as being unserved. And we know that of the 9,000 households we've identified, there are certainly some outside of the areas that we targeted. They're just so few and far between. We're confident that we've identified the preponderance of households in these communities that Skip just went through. So from our meetings with the Board of Supervisors and stakeholders, there were really three driving forces that influenced our work. Number one, solve the last mile problem. No one in the county should be without high-speed internet if they desire it. The second driver was no child left behind. The school-aged children must have access to high-speed internet when they leave school and arrive at home. And this has really become apparently clear from the current pandemic, that broadband is truly critical to applications like distance learning and telehealth as well. And the third driving principle is always on, that knowledge workers must have high-speed internet at their homes. This is really critical to fueling economic development, particularly in Montgomery County. increasingly knowledge workers are being attracted to Montgomery County. We're seeing software firms, robotics firms, unmanned aviation, supply chain management, logistics, and as you know, the list goes on. These folks move into the community. They may buy the the landed gentry home in the country and then find out that, oh my goodness, there's no high-speed internet. This is going to be an obstacle to economic development if it's not addressed. Skip and I heard story after story of individuals who live in very attractive communities in the county and have a complete dearth of broadband. I remember one person had good wireless coverage. He had 4G LTE, but he had data caps. Even though it's an unlimited data plan, when he hits his peak, they throttle down the speed. So what he had done was he bought 3 wireless subscriptions. And around the 10th day is when he maxed out his data plan. And he put that telephone away. He pulled out the second phone and he enabled the Wi-Fi hotspot. So there was a Wi-Fi cloud around his house. And that got him through the next 10 days. And then on the 20th day of the month, he put that one in the desk drawer and went to the third handset. It's just not acceptable in this current environment. And from what you all told us, it's not what you want either. Now, we came up with a ranking methodology to look at all of the communities based on what you told us was important and other stakeholders. There are 5 criteria. The first one, level of need. We assigned 40 points, which is the highest, by far and away, the highest weighted criterion. And if some households were completely unserved, they got full 40 points. An underserved house got 20 points. Second was the number of households. Now, it's important for you to know that scale is really important in telecommunications deployment. So a community of 600 homes is much easier to serve than a community of 20 homes. And the cost per household really will come down with scale. I think 656 homes was the largest community we identified. I think it's Tom's Creek. And the smallest was the eastern edge of Christiansburg, about 20 homes. And interestingly, both of these are unserved. The percentage of households with children, we assigned 20 points to this. Now, Skip, if I'm not mistaken, you use census block group data, is that correct?
That's correct, yes.
Okay, so we identified households with children. The largest community had 32% of the households had school-aged children. The smallest was 13%. Median household income, now this was a little trickier. We used this as a proxy for knowledge workers. Our thinking was the higher the household income, the more likely they were to be dependent on information technology for their livelihood. The highest median household income in a census block group was 106,000. The smallest was 33,000. So we allocated 10 points in this criterion. And finally, CapEx per household. And Thompson and Litton did a very good job designing the networks and developing capital cost estimates per household. I think the highest we have is around 8,000 and the least is around 2,500. So there was a little bit, this was sort of flipped around. The highest points went to the 2,500, the least points went to the 8,000. So with this criteria, we ranked all of the communities, and here they are listed from the number 1 most in need, the most important community to serve, Christiansburg, south of Franklin Street, followed by Shawsville, Walton, Tom's Creek. And you can read this list, and the lowest priority, Blacksburg Country Club, Ellett Valley, and Woodland Hills. Now our scope of work was really completed at identifying the unserved and underserved communities, developing a capital cost estimate to serve those communities, and coming up with a model and methodology to rank order those communities. That was our complete scope of work. And I realized that, and I think Mark Twain said it, it's kind of apocryphal, unsolicited advice is never welcomed and rarely followed. But we couldn't help ourselves because when we were selected by the management committee, we made a commitment to them that we would help develop an action plan that would make an impact. So we developed recommendations and we framed them in sort of 3 timeframes: immediate action that could be taken to really make a difference, intermediate action, perhaps something in the 1 to 3 year time frame, and long-term action, 3 years and beyond. We believe the most important thing Montgomery County can do to address these 9,000 unserved and underserved households is to allocate a resource to go after partnerships and funding to solve the connectivity problems. We specifically recommended tasking this individual with time-specific and measurable goals to turn up unserved and underserved residents. We also recommend considering forming or joining a broadband authority under the Virginia Wireless Services Act. Now, there is an existing wireless authority that the New River Valley Planning Commission is involved with, and it's the New River Valley Network Wireless Authority. And we think that would be a fine organization to join, but it includes Giles County, Pulaski, and Radford. Our only focus here is to make an improvement, to ameliorate the situation in Montgomery. That's why we would think that it might be something that you might want to consider doing with the city of Radford or with some other organization. I think it has to be 2 public authorities or 2 public organizations. This will make a very clear signal to the telecommunications world that you are serious about making an impact. In the intermediate time frame, we have suggested that you consider conditioning the permitting of new housing developments with a requirement that they build a fiber to the home conduit system. This will be so much easier to do now and have that thing utilized 3 or 4 or 5 years from now, rather than trenching up everybody's yards after the subdivision is built to put in a fiber to the home conduit system. We've done this and assisted some cities in California. We've provided our work products from those engagements to the town of Blacksburg. We feel strongly about this. The county attorney was very cautious, and when we presented this idea in, I think, December, and he wasn't sure that Virginia had the same abilities, but I think it's certainly worth looking into. We also recommend when opening a trench, for whatever reason, you consider installing telecom conduit. And finally, reviewing the franchise requirements and consider exemptions. We heard from a couple service providers that they actually view the franchise requirements in the towns as being something of a restriction. They don't make any bones about it. They want to cherry pick certain neighborhoods. And if they step into a franchise agreement, they're stepping into an obligation to serve the entire town when certain density thresholds are hit. They don't want that. So it's something to consider. And in the long term, we feel like fiber to the home is going to be the gold standard that you should strive to achieve everywhere, and you should take action to foment competition. We're in a very interesting time right now. Chantel has filed for a number of franchises in Comcast service territories throughout the Commonwealth, and that has compelled Comcast to file for franchise authority in some communities in Montgomery County. If we can do something to foment competition between the service providers, residents will win. That's our recommendations. Eric, do you want to go over the milestones?
Sure, and I won't go through all the details on this, but you can see we started the project in August. You can see all the tasks that we have completed, and to this date, we presented a preliminary final report on February 19th, just a little bit after the anticipated project completion in January. Went through several iterations and some discussions. Obviously, the COVID pandemic has hit and extended some things. But we had our last management team meeting just just a few days ago on April 30th. Did a few revisions to the report, which are included in your packet tonight. But basically, with this presentation, we feel that the project is pretty much wrapped up, unless there's some things that you all might bring up. But with that, I'd be glad to entertain any questions on behalf of the Thompson Lytton and Blue Ridge team.
Okay, we'll take it around the room again. Supervisor Blevins, do you have any questions?
I think that we should move forward with an authority and include the two towns with that. Would that be something that you would recommend? Developing it, if we go forward with an authority that we could include both the towns of Blacksburg and Christiansburg?
I don't know that it would have to include both. I don't know, Kevin, you might have some suggestions on that, but I think there are strength in numbers.
That's all I have.
Yeah, I think that the projects that are identified and the partners that come to the table will dictate whether the shape of an authority. That's probably a second step. One right now is just researching the options of what it will take to create an authority and or join one, and then look at the projects and the willing partners and see if an authority is needed to be able to execute that project.
That's going to be an immediate next step for us to look at.
I think with the COVID, the broadband issue has come to the forefront because with telehealth and Zoom meetings and COVID not going away anytime soon, it is going to be essential for businesses and for kids for education. So I see that it's only something that is going to be needed sooner than later, and that we should try to any opportunity. Competition is good, and so anything that we can do to bring those services to our citizens, especially now at this age of COVID, is a priority. Thank you.
All right, Supervisor King.
No questions, thank you.
All right, moving on, Supervisor DeMotts.
I don't have any questions, but I do agree with Supervisor Blevins' points completely. So I like the idea of us moving forward and forming our own authority to keep the focus on Montgomery County. And I know Bradford City was in partnership with us on that, or on this effort. So I really do like the idea of moving forward. And very good point about needing broadband in especially our underserved and unserved communities. As we navigate a pandemic, it really has become very obvious, and it's created a haves and have-nots situation, which is very unfortunate and not what any of us want for our community. So thank you all very much for the work that you've done on this and for providing the report. It is illuminating.
Okay, Supervisor Biggs, do you have any questions?
I don't have any questions, just comment. I would assume that Radford would be involved with anything because they were involved with the report, but I just want you to know that I have had complaints from Brush Mountain, and these were people that were working from home, of course, and were having issues, but I had told you that originally that was one of the places I knew of. And the other point I would like to make is, along with Supervisor Blevins and DeMotts, the children that are at home, the students that, you know, have been doing all of their work online, this has become really another whole issue. And with us not knowing what's going to happen in the future, if the COVID-19 comes back and we have to step back again or whatever, it seems like to me we need to get on with it. My greatest concern is the cost of everything. And I guess that's where we're thinking the authority can come in and they can borrow money and get grants and that kind of thing to help us move along. So I'm all for moving along. I wish personally we had done this a long time ago. So thank you.
Thank you. Brush Mountain, for some reason, ranked with a total score of 38. We could take another look at it if you wish. It's been a few months since we ran the model, but so I don't recall exactly what pushed it to the lower level of the priority list. But
It's not as densely populated maybe as like your Tom's Creek region, but that's been a constant complaint since, I can't, for the last 10 years at least.
the need is pervasive. The need is pervasive.
Okay, Supervisor Shepherd.
I don't have any questions. I think we should move forward with the authority and figuring out what we're going to do about that. I just appreciate all the work you guys did. Thank you.
Thank you.
Okay, Vice Chair Bone.
I have a couple of questions. Was there anything in your study that determined what was actually affordable service versus just getting service to the underserved or unserved areas of our county?
No, Supervisor, we did not address affordability. We realize that affordability is a factor in underserved. There are some residents that simply can't afford it. But in a lot of ways, we kind of approach these studies like Maslow's hierarchy of needs. It's more important to get the service out there and then argue about price.
Could you tell us the range of possible prices for areas around our county? As low as X, as high as Y?
We've done a lot of benchmarking and we can tell you that, but I'm not prepared to tell you right now. I can tell you that somebody in your community who is using the new service from Chantel with the super fast internet and the cable TV and triple plays, probably spending $240 to $250 a month. And there were some residents out there who are using a Viasat service that's probably in the $70 to $80 a month range. But that's approximately the range of the service offerings, their pricing.
Can the county take advantage of any grants at this time?
I absolutely think the county can. The list of grants that are available are staggering. I showed this at the management meeting the other day. This is a stack of all the different programs that are available, and they range from Rural Utility Services to the Department of Education, Department of Commerce, Appalachian Regional Commission, Department of Education. And if we can get capital through a grant program and go into a partnership with an operator, and several operators have indicated that they would gladly enter into a partnership agreement with the county, then is the opportunity to twist the arm to drive prices down. If we get grant funding for this network, you're going to have to come in and offer services at these levels. I think that's when the leverage is on your side. That's why it's so important to have a single point of contact in the county running these broadband initiatives.
Should we?
Bob, if I
Go ahead.
If I could just add to that, I think grant funding is a super critical component of this, and I will maybe put a sense of urgency on your actions that with the COVID relief efforts, there are lots of opportunities, but I don't think those opportunities are going to last forever. So I think time is of the essence, and I do think it's wise to educate and understand the funding opportunities, understand what the requirements are, what the partnerships may be, and then act on those expeditiously.
Should we wait to develop an authority to apply for those grants, or should we apply while we're looking for the right fit for the authority?
I don't think the authority is critical because the authority is not necessary to make application. The authority is necessary if you want to pull down resources from the VRA. So I think the number one step is allocate a resource to task them with solving this problem.
Is there a downside of joining the Giles and Pulaski Authority?
You know, we have one client here. It's Montgomery County. We have to put your interests first. And Kevin and I had some spirited discussions about this. I just feel like being part of an authority with 4 other legal entities is going to dilute the focus away from Montgomery County. There's plenty of need in Giles and Pulaski.
Is there a way to modify the present franchise agreements?
The service providers tell us that there is. Okay. We did not study the franchise agreements. I know that typically they follow a pretty standard format. We've seen hundreds of these things across the country. Specifically, well, we mentioned to the management team what service providers told us they view the franchise agreement as a barrier. So I think that there's a strong argument. I also believe that, and I told you this in our December presentation, market forces lead regulatory reform. If you had a service provider ready to deploy fiber to the home in Goldberg Estates or whatever, or somewhere in Reiner, of course, those areas are outside of a franchise agreement, but you understand, wouldn't you modify the agreement to get that to happen?
And what does it take to use the open trench strategy for planning purposes? What kind of building blocks can get us from here to there?
I think you'll need a condition of permitting in a new master plan community, just like you would for street lighting or setbacks or any other permitting condition. And it has to be to deploy a fiber to the home conduit system while the trenches are open. Put that burden on the developer. It's going to be cents per foot incremental cost. Very, very low cost to do it now.
In addition,
after the community is done, I'm sorry, Eric, go ahead.
I was just going to say, in addition to that, there's multiple opportunities with a dig once policy, but you have to have somebody that is cognizant of what's going on with water systems, with the highway department, with sidewalk improvements. So I think that's where you have somebody that understands the entire picture and can help when a sidewalk project happens. Say, hey, let's put the conduit in with that. We may not put fiber in it now, but we'll put the conduit in and we'll utilize that later. But it's understanding and seeing the big picture and how everything plays together.
You mentioned 9,000 underserved or unserved, but you also said that you couldn't count every single household that didn't have service or were underserved. If you had to guess, how many more would there be above 9,000 for the total of the county?
I'm going to jump in. I would think 9,000 is still a good number, because even within your existing communities, I'm sure you can identify communities within the communities we've already identified that have adequate service. And again, it's just a matter if you're on the outskirts of a particular build, or again, sometimes it comes down to how often your system cuts out is why it made into that 9,000. So I think that 9,000 is still a good number to look total wise.
Supervisor, I would guess it's under 5%.
Yeah,
that's what I was thinking.
Could you say that number, what you just said about 5%? I'm sorry, I didn't understand.
I would estimate that number is under 5%. So 9,400 homes is maybe the total universe. But if your home was in one of the 400 homes and you're sitting on the management committee and we didn't have a circle around your neighborhood, you're gonna pound your shoe on the table, which is exactly what happened.
One more question. The milestone chart, you don't have a year. Is that 2019 and everything was supposed to be done in January, or is that moving forward?
Yeah, no, the schedule was to be completed in January of 19. So most of the work was January of 2020. The work was predominantly completed in 2019, and of course it drug out just a little bit longer. But yeah, from August of 2019 to now.
I want to thank you. I think the report is very good, and I can't wait to move forward. Thank you.
Thank you.
Thank you. We'd like to say the management team was extremely helpful, fully engaged, and it made all the difference in the world. Thank you.
Bob, I just got a follow-up question on the placing of the conduit and the open ditches. Something that this board has talked about as we got a water project coming up. And also if it was possible to require that of developers. Is that really a significant enticement to a telecom or cable company to go ahead and put their fiber optics in? It was my understanding that the fiber optic, if I could talk right, if the fiber optics are really the most expensive part of all of it, but would that really be something that a company would jump on?
I believe it is. And Eric, you've had a lot of experience deploying outside plant. I think that the cost per foot is going to be very, very small, incremental cost, maybe 10 cents, 15 cents. But if you're a service provider coming into a new master plan community like in Montgomery County with great demographics, and you don't have to trench a thing. You just blow your fiber through that conduit. In some cases, they may have pull tape, but its speed to market is phenomenally faster once the conduit is in.
Absolutely, I agree 100%.
Okay. Truthfully, Steve, what I would do is I would have a competition before the first resident moved in to try and identify a preferred service provider who said, and you say, look, the conduit system's in, you're going to have to deploy 100% fiber to the home, and it's going to have to be something done on a cost-effective basis. Yeah, there are companies that would race to get involved with that, Steve.
Okay. Well, that answers my question. You certainly have given us a whole lot to consider and a whole lot to talk about in future meetings. Is there anyone that has a follow-up question for the team?
I just have one of Marty.
Not hearing any? Okay, go ahead.
I have one of Marty. Can we legally require the conditioning permit of new units to have the conduit system put in? Can we legally require that? Oh, I have to check. Okay, because that sounded sort of like yeah. Okay. Thank you.
All right, Bob, Eric, Skip, thank you very much. We appreciate all the work that you put into that, and we'll definitely be mulling it over as quickly as possible.
Thank you, gentlemen.
Thank you, ladies and gentlemen. Have a good evening.
Skip. Mr. Chair, our next item on the presentations this evening is an update from David Clark on VDOT issues. David, I see you're still hanging in there with us.
I am here. Can you hear me?
Yes, sir.
Apologize for not being on camera. I either can't get it to work on my laptop or it's not equipped for such things, but I'll keep going. Just a brief update on kind of what we've been doing over this last month. I know, don't believe I was there last month. And like everyone else, VDOT, our area headquarters and our residency office in Christiansburg has been trying to continue on work as normal with all the restrictions and things due to coronavirus. And just to kind of let you know where that is with us is that our residency office in Christiansburg has very few people working in it right now, just the ones that have to be in there who can't work from home. Anyone that can work from home is supposed to work from home. We have a sign posted asking the general public not come in, but giving a number and trying to answer as many questions as we can that way. I go in, just on a personal note, I go in for maybe an hour or so in the morning, and then I'm either working from home or in my car. I'm fortunate in that I have 4 counties that I can move around in. We're also fortunate that our crews are still working. So we do have crews in all of our counties working. We are under some modifications. They're not supposed to ride just 1 per vehicle, no 2 per vehicle. Our crews are smaller, our meeting sizes are smaller. Trying to keep distancing even while working, which is difficult, but we're still trying to get as much done as possible with our maintenance crews because we do have to prepare for contracts that are going to proceed. You've probably seen some of the paving contractors at work already. They've been paving between Blacksburg and Christiansburg on Route 460. Just kind of some of the other stuff that we're working on, normal springtime work with gravel roads, a lot of pipe replacement. We have had quite a few storms that have washed out pipe. We've replaced pipe on Reestale and Meadow Creek. In fact, we're doing a lot of work on Reestale Road. That's an upcoming project to replace the bridge there on North Fork Road, and Reestale and Flatwoods will be the detour. So we're improving that to handle some detour traffic. We've had our brush cutters out, and they've been on Price's Fork Road. You may have seen that. They've been in McCoy and a couple other places around the county. A lot of shoulder and ditch work on North Fork Road as well. And then again, just patching, doing a lot of patch work before the schedule work will start, the overlay schedules. I don't have the surface treatment and slurry schedule with me, but there will be some plant mix overlay, which we've already done in some of the subdivisions, and we will be doing McCoy Road. Our budgeting, I wanted to just touch on that in case anyone was kind of concerned with the economy taking a hit with the coronavirus. Right now, we have just been told to stick with our budget for this fiscal year, which we are planning to. We are to assume level funding for next year, at least at the beginning of it, as we make our plans for next fiscal year. We're funded on a fiscal year basis, so that fiscal year will end the end of June. And we'll reevaluate as projections go throughout the rest of next fiscal year. The projects, the big projects that are going on are still going on as planned, and they're on schedule. The bridge 81 at exit 114 over Route 8 is progressing. The New River Bridge project is behind schedule, but they are still progressing. And we have a revenue sharing project that's been put out to contract on Mount Pleasant Road, and they have a time of year restriction. They've been in there cutting some trees, but I can't remember what the date on that one is. It's a end of year or the end of contract date is sometime this early fall, late summer. So that's all I have as far as the updates of what we've been up to. I'll take any requests or questions.
Okay, Supervisor Blevins, do you have any questions?
No questions, thank you. No questions.
Okay, Supervisor King?
Just one question. I know y'all on limited staff, but have we got any closer to limiting big trucks on Meadow Creek?
I have not heard the report on that one. Yeah, I'll find out on that. Yeah, there are, you're correct. Some of the staff restrictions, I think a lot of those studies are being delayed. But I'll specifically find out about that one for you.
All right, thank you.
Supervisor DeMotts?
I don't have any questions, thank you.
Supervisor Biggs?
I do not have any questions at this time.
Supervisor Shepherd?
Mr. Clark, all I can say is wow on that trimming on Price's Fork Road. That is marvelous. As a matter of fact, can we just keep that crew moving throughout the county, even more in this district?
Yeah, it would be great. It looks a mess for a little bit if you're not used to seeing something like that, but you'd be actually surprised how fast it grows back through, and it really does open things up. It helps us in all kinds of things. You know,
I'm sure. I've had
snow removal, makes snow removal easier. It makes everything a lot easier.
I've had a lot of compliments on that job and the need for it. And also I had a couple complaints about, not really complaints, but questions as to why they went down toward the tunnel at the Arsenal where there's not much traffic. But anyway, I appreciate what you did.
I've been down there and took a look at that Price Station Road, I think it's called. Yeah, there must have been a complaint or something like that. Somebody must have called a work order in for that. So they went ahead and took it down there. But yeah, that's not a highly traveled road.
No. Thank you. That's all I
have. Vice Chair Bone?
Mr. Clark, is there any opportunity to put any new conduit on Dry Run Road because it washes out every single time?
We're waiting for some environmental clearance to fix the part that's now got the road closed to through traffic. It's about 1.25 miles up, I believe.
Could you speak up, please?
Can you hear me now? Can you hear me?
Not really. Yeah. Try it again.
Yeah.
Hello? Is that better? I don't even know where the microphone is on this, so.
There you go.
Is that better? I'm glad you can't see me because my face is like right up next to the screen. The conduit, the pipe on Dry Run Road, I mean, it's just a difficult situation because the road is so low compared with the creek bed. In fact, when I first started working here, those were open fords, which now that we think about it, it might have been a better thing to have just open fords because then you could get through and the pipe wouldn't wash out all the time. But that did make it really extremely difficult in the winter when all those open fords were frozen. But to get any larger pipe or pipe with more cover would require a major reconstruction of the road to raise the road, which is why we're in the kind of position we're in with a pipe that's got to fit in the road cross section that we have.
So what would it take in order to fix it?
It would take a reconstruction of the road. It would be put on the 6-year plan to get right of way and raise the road, have a hydraulic study to size the pipe for probably a 10-year storm and raise the road appropriately to accommodate those pipe.
Is there anything that you can do to prevent all the washout going down the stream? You look at the stream and it's basically all that fill. There's hardly any original stream left.
Yes, I was noticing that myself today. Again, it's the characteristics of the road being that low, and as often as that washes out, I don't know any other way of keeping the road within the travel portion, or keeping the stone within the travel portion of the roadway.
I want to thank you for filling the potholes in my district. They look pretty good.
Thank you. Yeah, I was noticing some of those today too. They have been out there.
And then one question about 460 bypass, and I know that's not your jurisdiction, but I still want to ask the question. So there's repaving, and I imagine that some of that repaving was trying to get rid of some of those dips before and after that one bridge at Yellow Sulphur Road. I think that's what it's called. But it's still pretty dippy. Are the contractors gonna go back and like flatten the road, or are they gonna just let those dips still exist?
They should have been taken care of with the paving. I didn't notice them specifically.
We can't hear you.
In years past, there's been these huge dips there that we have gone in and fixed. I'll check the one on Yellow Sulphur Road, but right now I don't think there's a plan. I think what's there is what they have is the finished product, except for the line painting.
I'm just talking about 460 bypass at the Yellow Sulphur Road Bridge. So I'm not talking about Yellow Sulphur Road. Just thank you. Thank you for everything you do, Mr. Clark.
Thank you very much.
David, I've just got a couple of things. You were speaking about the upper part of Mount Pleasant, and I didn't quite understand. They started working and they had all the signs up and ready to go, and then they stopped. Why was that stopped?
They had a certain amount of time where they had to cut the trees. We have a time of year for mostly it's bats, I believe, that you can cut the trees. There was probably a subcontractor that did that. The contract, I don't have the completion date, but then the contractor's under a specific time limit, and I'm not sure when that completion date is, but they're still being held to that date. I'll get you the date that they're supposed to complete.
So they have to wait until another time to finish the tree cutting before they can start on the road. Is that what you're saying?
No, I think they've got that part. Now it's just their company's schedule on when they want to, proceed with the rest of the work.
Okay. So that's not something on your end, that's on their end is what's slowing it down.
Correct. They still have a contract date to complete the project.
Okay. I'm kind of jealous. I heard there was some pothole paving. I sure would like to see a little bit of that myself, but and that leads me to my next question. You had mentioned your crews were still working, so they're still going out and doing the routine things like pothole patching and whatever, correct?
Yes, they are.
Okay. Last thing, we were getting some tree cutters. It was a contractor on Allegheny Springs. I've seen them out there twice. I don't know how many times they've been out there. They're running a flagging operation, and I don't know if anybody has checked on them lately, but they seem to put up their signs, and then they have an extremely long gap from the last sign until they get to the flagger. I don't know if maybe somebody needs to look into that. I don't have my handy dandy work zone manual anymore, so I couldn't give them any advice, but it just seemed like a long time, and they're using those newfangled bumps in the road, or I forget what you call them, but they're using them, and so people slow down for them, and then the gap is so long that they pick up speed thinking they're not there, and I'm sure they're running up on them pretty quickly, but just something that your safety guy may want to look into.
We will definitely do that. Thank you.
Yeah, it's right along the bluffs there on Allegheny Springs is where they've been working. So that's all I've got. Any follow-up questions for Mr. Clark? Okay, hearing none. We thank you very much, David. You have a good night.
All right. Thank you, everybody.
Thanks.
Craig, do we have anybody signed up for a public address?
No, sir, we have no one signed up for public address this evening.
Well, I don't know if we need to open the public address, but if I do, then I'm going to close public address. Next item is addendum. Do we have any addendum?
No addendum this evening, sir.
All right, next up is items of consent. Do we have a motion?
Motion.
Second.
We have a motion and a second. Madam Secretary, if you call the roll.
Mr. King?
Yeah.
Ms. Bone?
Aye.
Ms. Biggs?
Aye.
Mr. Mott?
Aye.
Mr. Marks? Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Chair Guzekowski?
Aye.
7 ayes.
All right, our next item is to go into work session. Do we have a motion to go into work session?
So moved.
Second.
Okay, we have a motion and a second. Call roll.
Bone?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Blevins?
Aye.
Mr. King?
Aye.
Chair Guzekowski?
Aye.
7 ayes.
All right, Craig, did you want to lead us in this first item?
Well, I'll introduce the first item that was asked to be added for a work session discussion this evening is a proposed resolution or letter to the governor on the Commonwealth's approach to reopening the economy as part of the recovery phase of the COVID-19 pandemic. As most of the board's aware, the governor announced last Friday a phase 1 plan to reopen. Just got quiet in here. I think the air handler went off.
Yeah.
To reopen on a very limited basis, certain businesses and activities as of this Friday, May 15th. He reiterated today in his press conference that covered Virginia, except for Northern Virginia. There are several localities in Northern Virginia that still are seeing dramatic upticks in their numbers, and their elected officials there had expressed a desire not to be included in any opening at this time. But I know in conversations with the chair, there have been other discussions. Some communities prior to the governor's announcement last Friday had issued letters. I believe Roanoke County board sent a letter to the governor. Giles County's board did a resolution. And I know that I think several of you wanted to have a conversation about something similar if you still felt that was worthy based on where we are with the governor's announcement last Friday.
All right, well, in order to keep this conversation going, I guess we're still going to have to use this roll call system. So I'm going to go ahead and start with Supervisor Blevins.
Aye. I feel supportive of this, especially with the Dr. Bissell's report saying that we are prepared and that we have a 4.5 positive rate for our testing. I feel that especially because of the economic impact, this would just be a good way to reinforce and support our businesses that they can open safely with precautions. But I think it's a movement forward that we need to take. So I would be supportive of either a letter or a resolution just saying that we support the reopening phase safely, and encourage our businesses to take that personal responsibility. According to the task force, we've done such a great job and want to continue that with communication, education. It's not going away, so we're going to need to learn to live with it. And so we need to do that. Now, I also agree that it should not be a light switch kind of deal where you turn everything on and we go back to normal. Obviously, there is not going to be, there will have to be a new normal. So I'd like to do that safely, and I think that's a good way to move forward to encourage our businesses. So I would be supportive of a resolution or a letter.
Okay, thank you. Supervisor King?
I would be in support of sending the governor a letter, as you know, as Craig has mentioned, he said he's going up and sum up on Friday. And this would just be supporting our small businesses in here in the county. And like I said, I would be in support of sending a letter to the governor.
All right, Supervisor DeMotts?
Well, just a couple of things. I think it is important to note that the landscape has changed since this idea even came onto the agenda of sending a letter forward, because we are moving into phase 1 of the reopening process. Also, I have a lot of concern about confusing the message when we have been so heavily reliant on the task force to direct kind of the whole community, and in a lot of cases, the whole region's response. I think that something specific might cause confusion. If we're sending a letter supportive of the phased approach that we're already taking, I think that's superfluous. But then if we're sending a letter urging something and the rest of our say Virginia Tech, Blacksburg, Christiansburg are not sending a similar message, I think that confuses the message and the point and purpose of the task force. So I support the phased approach to reopening. I support what the community is doing. I support what the task force is doing moving forward. I just don't know at this time, given the change since even the agenda came out, I don't know if it's necessary anymore to even give consideration to sending a letter, because we are moving into a new phase of reopening the economy. So those would be my concerns.
Okay. Supervisor Biggs?
Yes, I don't understand why we would be sending a letter when we're going to have the phase 1 opening May 15th. And we just heard from the task force. I specifically asked that question, were they on board with the May 15th? And it sounds like they are with everything they have in place. So I'm not sure what the purpose of the letter would be. I did listen to the governor's press conference today, and he said no region wouldn't be moving faster. And I don't know if the purpose of the letter is to try to say we want to move faster than phase 1. I mean, we're starting phase 1 on Friday. I am in support of starting phase 1 on Friday, as long as that comes, from the state and everything looks good with what they're doing. And I just, I'm not understanding what the purpose of the letter is. Are we just saying a letter and saying to the governor that we're supporting his phase 1? Or what is the purpose of the letters? What I want to know. I don't understand it.
Okay. I think that's what we're here to discuss. So, Supervisor Shepherd?
I'm in support of sending a letter, and not so much towards the phase 1, but how long is phase 1 going to last? That would be my question, because the numbers here are much lower than they are in Northern Virginia. I think with some common sense, we could open up some of the other smaller businesses. I don't know if anybody's been in Lowe's recently, but they're packed. I've been over there twice in the last couple of weeks, and they've been packed times. And I go to the grocery store at will, and I mean, I see people in masks and, trying to do their best. And I think that's the common sense part of it. And so I'm in support of saying, I think we should be able to move along a little faster than Northern Virginia.
Okay. Yeah, I watched the governor's briefing today also. And my feeling on the letter is it is needed because he needs to hear from all the jurisdictions out here in Southwest Virginia. I don't have a problem working with the two towns, but if they don't want to do it, I would still want to do it as a county. I think he needs to be reminded that, and we heard the numbers tonight, our positive rate is 4.5%. Northern Virginia is 25%. I could understand why Northern Virginia wants to slow down. But the rest of the state, he said, averages about 10%. So we are doing twice as good, the way the numbers look, than the rest of the state. So I would like for him to consider regional, speeding up things regionally, but still do it in a safe manner and do it phased in. But maybe our phases could move a little bit faster. The other part of it is that the governor said he didn't want to do it regionally, but I don't know if he can't step back and look at what he's done with Northern Virginia. But he's done it regionally. The rest were the same thing as us speeding up. So I don't really see a reason why that it can't in the face to the governor. We're just asking. A lot of the task force people have been asking for this. He said he might open it up on May the 15th. He said it might. So he's still leaving the door open that it may not happen. And he's looking at his numbers and his data, but from what he was showing, all the data is going in the right direction. So I guess he's going to wait till Friday morning, and when he sees the last of the data, then make a decision. So I think having something on record, such as a letter or a resolution, is very proper to let him know that this is how our region is doing. And we feel that as grown adults, we can be trusted to open things up safely. And if for some reason, as Dr. Bissell said, things start escalating, then we can slow it down just like Northern Virginia can. That's just my feeling on it. Any follow-ups? Supervisor Biggs?
Chair Fidzikowski, you skipped me.
Oh, I'm sorry. You let me rant. I appreciate that. Vice Chair Bone.
I particularly like what the task force or Dr. Bissell talked about today. No question about it. It seems like we as a region have a good handle on what we can and shouldn't be doing. I like to err on the more conservative side. I love the 4.5% that we are at, but wouldn't it be great to never have another death and never put anybody else at risk unnecessarily? So opening faster, I'm not necessarily for that as long as the task force says that the rate will stay the same or go less. I'm a positive supporter of that. It really bothers me to think that we have a choice here, and I don't want to put anybody's life at risk unnecessarily. So I am not excited about I'm not saying that this letter or resolution is arbitrary at all. I understand your concerns and they're very valid. I am totally supportive of the small businesses and the employees that want to get back to work. But we don't want to encourage any unnecessary risk. So I would ask to rely on our task force more than the governor. I agree with you, Chair Fidjakowski,
Well,
that the governor is doing a phased or regional approach anyway. Completely understand. But again, I wouldn't want to put anybody at risk more than necessary. I would like to understand the business liability when the businesses are open to go back to work. I know that's a federal decision. I don't know if there's anything that the state can do about business liability, but I think that's really, really important. Again, we want everybody to go back to work healthy and have a very healthy experience at their work. But sometimes the business liability constraints help that process to move forward. So I'm not sure if there's anything we can do to help facilitate that. So if this letter or resolution, and I would recommend if we have a majority vote, that it's a letter or resolution, I would recommend that it be a letter and we add everybody's points of view in that letter going to the governor. That's all.
okay, I was listening to what you were saying, and I think the way you described what you thought needed to happen is impossible. The task force cannot give you a guarantee that nobody's going to die. They can't give you a guarantee that the numbers aren't going to go up. They're going to go up. Everybody knows they're going to go up. But as long as they're manageable, they're confident in moving forward. I don't think the task force really said that we only want to go as far as governor's first phase. That's all I'm saying. And all I'm saying is we need to have some flexibility. We're not asking to start a war or something like that. We just want to have a little bit more flexibility based on our situation. And to have the entire state minus Northern Virginia judged the same way that's just not right. It's not fair. But there's no way that you can't have risk. There's always risk. There's risk now, never mind on the 15th. There's always going to be risk. That's why we have to take measured steps, but we think we can take a few more steps than the rest of the state can. That's all I'm saying. Anybody else?
Chair Fidjakowski, your video isn't working, and I think that if you turned off your video, your audio would probably work better. When you were talking, you were breaking up, so hopefully that will work. Thank you.
Okay, well, thanks for letting me know. Is this any better?
Yeah.
Yeah, your audio is,
Can you hear me now?
yeah, your audio is clear.
Okay, all
Chair
right.
House,
I got the video off.
this is Supervisor Biggs again.
Yeah, Supervisor Biggs.
Yeah, I'm still not understanding what the purpose is. It sounds like we have two different things here. It sounds like some people are saying, well, we could send a letter and saying that I specifically asked Dr. Bissell, and she said that the task force was comfortable with phase one. It's almost like why are we trying to walk before we crawl? The first thing we need to do, and I know the chamber's worked hard on getting businesses ready, why aren't we giving people a chance and our citizens a chance to feel safe and comfortable going back into stores and that kind of thing? Why are we trying to rush into phase 2 before we've done phase 1 and we've seen how phase 1 works? I think that I personally, I support.
I'm not saying we're.
Well, what are we trying to say? I'm confused what we're doing.
I'm not saying that we should go into phase 2 because I don't even know what phase 2 is. What I'm saying is if we have the capability and we have the numbers, which obviously the task force has got the excellent numbers, then we might be able to take steps. You want to know what they are? I don't know right now. I don't know what that would be. But certainly this end of the state is in a different position than the rest of the state by the numbers. So, you know, I'm trying to stick with the numbers. That's what everybody understands. But I can't argue against risk. And I can't say, well, if we allow somebody to go into a restaurant, 6 people on the other end of Christiansburg are going to get sick. I don't know that, and neither do you. I'm just saying our situation is different. We should have a little bit of freedom. And I don't mind working with the governor's office. If we made a suggestion, hey, could we add this to our phase 1 and see how that floats? Obviously, we seem to be having to stay within his boundaries. So I'm just saying I would like him to know that we feel that that our situation is different than the rest of the state. That's it. And we could take more risks.
Sure. Well, I guess I'm supportive of what the governor has laid out. Me personally, and the district that I feel that the people that I represent would feel supportive of what the governor has laid out. You try it, and there's a lot of concern and a lot of talk out there, and it was mentioned tonight. People do not know what's going to happen as far as when Tech comes back and Radford comes back. Tech hasn't even worked it out how they're going to work this. Evidently, that will be June 8th. Okay, so we've got all these different parts to the puzzle that haven't even had a chance to come together. And it's almost like we're trying to push by saying, well, we're different. I mean, yeah, we're different. I mean, there's differences all across the state. The governor has tried to do, I think, the best that he could do to keep Virginians safe. And it has cost our businesses. And I think the idea is to open it up. Let's support our businesses that can be a part of phase 1 and not feel like we're out there trying to add too much at one time. I'm comfortable with what's going on now. And I know that, you know, schools haven't even been decided for next year. I think that we should go about this like in a logical manner. And maybe that's just the way, you know, coming from being an elementary teacher, you know, you plan, you execute your plan, you look at your plan, and you see how it went. You evaluate it. So why can't we take phase 1, the plan, see how it goes and evaluate it? What's the big hurry to tell the governor, hey, we're going to do phase 1, but we might want to add to it? I'm just not seeing what the purpose is. That's all I'm saying.
Well, so you're saying that his plan is better than our plan, that we don't even know what we're going to do?
Right now, I'm very comfortable with the governor's plan because we've moved. I think it saved lives. And I think that to move, and he said Wednesday we would know. So I think to move to phase one, why can't we do it? Why can't we try it? Why can't we get everyone comfortable with it before we start talking about doing something?
Well, we will be doing it, but we will be doing it if he approves it on the 15th. So, yeah, we're not stopping that. We're not changing that. The letter is to just let him know that we feel that we can justify going and doing some other things in a safe manner.
Well, without knowing what those
Anybody else want to jump in on this?
I can't support that. Yeah, I think Supervisor DeMott's.
Okay, I understand.
I just wanted to I guess, reiterate, I am very uncomfortable with us kind of deviating when the regional approach to this has been so incredibly important. I'm very uncomfortable with us deviating from that and making a statement for Montgomery County that includes the towns of Blacksburg and Christiansburg without speaking. And that's coming from the perspective of my district is almost entirely within the town of Blacksburg. So if we move forward with a letter, I'm essentially saying I know better for them than they do for themselves. I'm just very uncomfortable with the division that could create with the two town councils that are also elected by citizens of Montgomery County. I'm very, very uncomfortable with moving forward with anything unilaterally speaking on behalf of all of Montgomery County because of that. And I'm not really debating whether or not I'm comfortable with the phased approach or safety or businesses reopening. I just think that it is extremely important if we're going to communicate something on behalf of our community, that we communicate on behalf of Montgomery County, the town of Blacksburg, and the town of Christiansburg. It is very important to me that we speak with one voice because that's what we've been doing since the beginning.
And Chair Fizikowski, along with that is Virginia Tech.
Chair Fizikowski? Steve?
Go ahead.
All right, this is Sherry.
I can hear you. Go ahead.
Okay. My thought of the letter or resolution was to support, and we talk about the governor is going to use the phase one. I don't think, from my perspective, that we are trying to rush anything because we want to be proactive. We want to be safe. We want to be responsible. Looking at the regional, aspect, we had the Montgomery Task Force. We are the model for the state. From there, we moved to the NRV Task Force, regional approach. They have already provided us with the guidelines for the businesses as moving in the recovery phase because this region is ready. We have only a 4.5% positive. We are different than Richmond. We are different than Virginia. However, obviously we can only do what our governor asked us to do, but we are in a different spot than other places in Virginia. I am comfortable with Dr. Bissell's review today of that we are ready to move forward. I think our businesses need a letter of support saying, and it is about a choice. We're not saying you have to open. We're saying that we support you if you do open. We already have the chamber working about trying to build consumer confidence of what people need to do. We're trying to educate about personal responsibility. It is about a choice. COVID is not going away, so we need to move forward. Economically, this is going to kill us. It's going to devastate our towns. Now, I do believe, Supervisor DeMott, that do we know where the towns stand? Do the towns support this or not? That would be something, a conversation I would be willing to have because I feel the more makes a strong voice. We have to look at the future. We do want the students to come back. The students are going to come back and the businesses are not going to be open. Our stimulus and CARES Act money is going to run out. We got to look at the future. And so we need to make, so my perspective is that the the letter of resolution is just to say, we support our businesses, we are ready. And we have the option to go back and look. The governor said some restrictions can be different localities that they give, is going to give the floor. We were the model. We moved forward. We had the foresight. We had the people there that are looking at these things. Our guidelines were out before the governor's guidelines came out. So I think that we should give our county the opportunity, our businesses, particularly our small businesses, the credit that they will do what's right, they will move forward, and that we can always reevaluate. We can always say, all right, we're not trying to push it into phase 2. We want to do this conservatively. We want to do it slowly. We want to do it safely, responsibly. But we want to give our businesses a chance. And it is about business. And we didn't become a country because we always hid. We became a country because we became the great country we are today because we took risks. And so there are safety precautions, but that's what I think, that we should move forward on the letter saying support and then give with the guidelines. And I would like to see what both the towns input on that too. I would like to see that.
Chair Kuchikowski, can I ask
Supervisor King?
Yeah, I just wanted to know, so your letter, are you saying the letter goes to the governor or the letter goes to the small businesses, and it would just state that we're in support of phase 1? Is that what you're saying?
The letter is to the governor.
Okay.
And because, as the governor says phase 1, that already gives the guidelines and allows businesses to open. But I just think that in this area, we're ready. We need to move forward. And it would be supportive, it would show support to our businesses that yes, Montgomery's behind us. They're going to work with us, and that's what we're going to do. We have to support our businesses. We would work, as we're going to work with Virginia Tech to make sure everything's safe for their students. We all want a football season, right? That's going to happen with partnerships, and we are the model. And so we have to, in my opinion, you're right. You have to assess the risk, you have to evaluate, and then you have to make a decision. And we have to move forward, and we can do it cautiously, proactively, and then we can always reevaluate. We can always come back and look at it again and say this didn't work, but I feel that we need to move forward. So the letter is to the governor, and it's stating why we support the reopening, why we support to do it safely, and we could use our statistical information to say that why we feel ready
to support phase 1.
Yes, and or to do it and maybe what if phase 1 doesn't work in other localities but it works good for us? Should we not move to phase 2? And of course, again, we only can do what the governor, what the state tells us we can do. We have guidelines that we would do, but we want to just let them know. I think we need to be a voice. Say yes, we're ready and we're supportive of reopening.
Chair Steve?
Yeah, go ahead, Supervisor King.
Well, I'm in support of sending a letter to the governor. Could we put in there and encourage him to open it regionally? I mean, at one time when he spoke, he said we shut down as a Commonwealth of Virginia, we're going to open back up as a Commonwealth of Virginia. I'm in support of sending a letter telling him, the shape that we're in, 4.4%, they encourage him to open it regionally, to look at this Commonwealth, not as a whole, but in each region.
Yeah, I would be in favor of that. Maybe what we need is to have a draft of a letter so that everyone can look at it and see what they think. If they think it's pushing too hard, then maybe we can alternate it. It also might be an opportunity if we come up with a draft that everybody is comfortable with. We could share it with the 2 towns and see what they think. But if we drag this out, it could be the end of the year. And I don't want to wait till the students come back. I want something sent to there before then, Because if we wait on the students, then what will we be waiting on? Thanksgiving? I mean, Christmas? You know, we can't be, there's always something on the horizon that might frighten people. But I'm not saying we have to do something to frighten people. I'm saying that we want the flexibility and we want the governor to consider that. And you're exactly right, Supervisor King, regional. And that's what was asked for several weeks ago. And he said no to that, but now he's already gone and done it.
Well, could we ask a question?
So I'm just asking for that to be extended.
Could we ask a question to the board if
Go ahead.
if they would be comfortable if we send a letter saying to ask him to look at regional?
Are we looking for a
How
consensus?
does,
Are we looking for a consensus?
I was just wondering if y'all.
yes.
If we done it, if we said, oh, the region, to look at the Commonwealth in regions and not as a whole.
I personally think that the research out there isn't clear about regional selectivity. Does anybody have any data about regional selectivity during the pandemic? Or are we making it up as we go?
I don't know what regional selectivity means, but I know that our positive percentage of tests are 4.5%, and the rest of the state is 10%.
Is there anywhere else in the United States that has chosen the regional approach and that it has been more successful than not a regional approach?
I do not know.
Is there a way for us to find out?
I don't know that either.
Well, I don't feel comfortable making that choice without proper data to make the choice from. No question to me, it kind of makes sense, but this world interacts all different kinds of ways. That if, you know, we open up and, you know, the first case was a student coming back from spring break. You know, come August, we might have 35,000 students coming from all over the world. I don't know, but I sure would like some data so that we could make some good recommendations.
I would just like to add, and just to toss out for consideration, I'm perfectly comfortable with transmitting to the governor our information about our infection rates and complete support of our business community. I would be more comfortable with something coming factually maybe from the task force to kind of give some background information, because I think anything we can communicate about how our community is weathering this is valuable. Now, as far as reopening regionally, I certainly understand, you know, our region is affected differently than, say, Northern Virginia or Richmond. However, if we reopen, say we reopen and our restaurants and bars are able to, you know, do in-person dining or you know, you can have a cocktail at the bar, or our parks and recreation facilities are open, our tourist destinations are open, then people are going to come here from other places that are closed. And so I think that plays a bit of a role in some people having some reluctance to move to a regional approach. And that does give me a little bit of pause as well. Just thinking if this region is open, what is going to prevent people from regions with much higher infection rates from then coming here to stay, play, you know, spend money in our businesses, which would be welcome at this time, of course. But I just have some concerns about how what impact that can have. And as Vice Chair Bone said, there's really we don't have any data. There's no, we have no method by which to track this. So I just circle back to, I am comfortable communicating as a region using the methodology that we already have in place with the task force. I'm completely supportive of our business community, and I think our region has done an amazing job moving through the pandemic. But I'm just very cautious about sending a message from Montgomery County that may not reflect all of the citizens of Montgomery County and all the elected officials in Montgomery County as well.
I would like to concur that the business community, and perhaps I can speak for the board, we are very supportive of the business community. There's no doubt about that. I think what we're talking about here are multiple things. We don't have anything concrete in front of us. That starting with that would be a good first step, because we've talked about a lot of things, of which what we have in front of us for the work session has a few of those things in it.
I'd like to make one comment. Just about lost my train of thought. I was thinking about if Virginia Tech comes back and we have not already started opening back up, what's that going to look like? I mean, and we don't have any control over that. And the task force seems to know a lot about what's going on, and they have the numbers. And I wouldn't be against, sending a letter saying we want to open regionally and use our task force as a guide for what happens.
Yeah, I think we definitely would want to use the task force, because the information I've been getting from them is they have already been talking to, I'm probably not the governor himself, but to his people that are making the decisions on the phases, that we were ready and are ready. And I think they've already been making that argument. And we may all be kind of blowing up a little bit, but it's going to be his decision. We can't supersede the governor's emergency orders, so it's going to be his decision. We just would like him to think regionally, since he apparently is moving in that direction anyways.
Could I make a recommendation that a few of us or anybody can send Mr. Meadows and Mr. McMahon their input for a draft letter, so that we can potentially work from it and potentially review it next meeting at a work session?
Is anything that
I'd like to get a draft and maybe circulate it prior to the next meeting.
Okay, then is the idea to see what the towns think, or Virginia Tech thinks, or the task force thinks, or is it just a Montgomery County thing all by itself?
No, we can. I would be comfortable sharing that with them.
I think it's the right thing to do, just in the spirit of continued collaboration and continued positive relationships. I think it's the right thing to do.
I do too.
Mr. Chair, this is Craig, I would suggest that if board members want to send comments, thoughts, what they'd like to see in a letter, if they'll send that to my attention and or Marty's, we'll work with Jennifer to have something drafted in the next week and have it back out to y'all so you'll have something to review at your next meeting.
Could we also reach out to?
Okay, do we need a consensus?
I'm sorry, Chair Steve, can we also send that?
Do we?
Can you hear me, Steve?
Yeah, I can hear you. Go ahead.
So can we also send that, or I would like to see what the town's input, Virginia Tech, obviously. But Supervisor Shepherd made a good point. If the students come back, we need to be ready for them, and the businesses need to be ready. And the letter is not to supersede anything that the governor says. We just want a voice to say that we are in a better spot than most of Virginia, and that we support our businesses and want to help build that, open it, but do a cautiously responsible way. And that will also help build consumer confidence. And again, it's a choice, but I think that would be something that I'd like to see, and reach out to Virginia Tech and to the towns to see what their input would be. And I think that's a good idea.
My only suggestion to that, Supervisor Blevins, would be let you guys get comfortable with what the letter is before we send anything to the towns. And that being said, I can go ahead and mention it to the two town managers in the next day or two. But I think you guys get comfortable with the draft, and then we can share that draft with their elected officials, because we'll just have a lot of this going on.
Yes, sir.
Well, if you do that, because if we're gonna have something drafted by the next meeting, we're not gonna have time for the two towns and Virginia Tech to have meetings to see what they want to say. So it'd be good if you just reached out to them and said, look, this is what the board is planning on doing. Do y'all want to be part of it? Do that. I mean, you see what I'm saying? If we wait till all three of them have the meeting, then it's gonna be Thanksgiving before we can get anything going.
I can certainly.
And I would add that even if they don't want to be part of it, if they don't object to it, then we can go forward.
But if they don't want to be part of it, we can still go forward. I mean, you know.
So we'd be speaking for them.
So
yeah.
We would say from Montgomery County.
But the two towns in Virginia Tech are in Montgomery
Yeah,
County.
I mean, I have maybe 20 households in my district that are not in the town of Blacksburg.
But what I'm saying though is if whichever angle they towns, if they say we don't want you to do that, we shouldn't do it. Is that what you're saying? This 7 board here represents the whole county. So if one entity says y'all don't do that, we shouldn't do it. Is that what you're saying?
We don't represent the whole county within the towns. Well, with regards to some items, they have jurisdiction over their towns more specifically. But what I could say is we would only speak for outside of town limits if I would recommend wording the letter and the towns didn't agree. Regardless of 20 households or, a third of my district is outside of the town. So I could speak to that population and vote for that population, because I don't think it's right for us to represent in this instance, individuals within the town limits. So.
Well, and I guess to the point that I would like to make is for my district and for the majority of Montgomery County, I would venture to guess, these businesses are located in the town limits. Mm-hmm. So we want them, if we're going to transmit a message, we're speaking on behalf of, a lot of the town's budgets are heavily dependent on VPOL taxes, sales taxes, transient occupancy taxes. Ours is real estate taxes. And so this is a very interesting dilemma to be in, because yes, we do represent all of Montgomery County, but if we're talking about, supporting our business community, then we need to kind of give a lot of consideration to where the majority of that business community is located. So yes, in my opinion, if one of the towns said, if we put forward a letter that is controversial and objectionable to either one of the towns, and they said, you're speaking on behalf of us, but we don't share your view. I mean, we should be giving that a lot of consideration. It's not worth damaging those relationships, especially as we try to recover from a global pandemic as a community. I don't think it's worth damaging those relationships to send a letter to the governor that in reality ain't gonna change anything. It's not like a letter from us and he's gonna go, oh, magic, they are speaking the truth. Everybody is saying that to him. So,
you don't think the towns would be in favor of opening up their businesses?
No, that's not what I'm saying, Chair Christiansburg. What I'm saying is if we are sending a message and one of the towns objects to the message that we're sending, I'm saying that we should be thinking about the relationship that we have with that town, whether it be the town of Christiansburg or the town of Blacksburg. From what I'm gathering from the various points that are being made during this conversation is we have a lot of different perspectives that we want to cover in the letter, and that it is at least important to several of the people here and possibly, I mean, I can see Daryl, I can't see whether you're nodding your head or not, but that at least it's worthy of consideration that we give thought to a message that includes the towns instead of usurping the towns and sending a message without their at least knowledge or consent in some way. I'm very uncomfortable with creating a divide where it is not necessary to create one.
And I would.
Well, I don't think usurping is really the right word to use on that, because we are an elected body, and we have to make decisions too. And if the majority makes that decision to send a letter, then I guess a letter's going to get sent.
Right. I understand.
Well, I would just like to sort of echo what April's saying, like the whole phrase is we're in this together and we're going to get through it together. So you've brought all these entities together that have worked so hard to make this work. The New River Valley Task Force, they've worked hard to make this work. Most of the businesses are in the two towns, as Supervisor DeMott said. Nobody's saying we don't want businesses not to open. Phase one opens businesses. If you go and look at the whole plan, phase 1, 2, and 3, it's laid out. So I'm not sure what I sort of, that's why I was asking Supervisor Blevins what she was trying to say. I could support sending a letter that says we're in support of phase 1. And here are our statistics from Montgomery County. I'm not in support of saying, hey, we're supporting phase 1, but we want to do a regional approach right now. I'm not there yet. I want to see what happens with phase 1 and how our community and our community's resources are going to be able to implement that. I want to make sure that the businesses feel like they have proper whatever they need, PPE, whatever they need, sanitizer, all of that. I want to feel like, people are comfortable going to the businesses. And so I guess what I'm saying is, I like the idea of Supervisor Blevins' idea of sending a letter stating that we're in support of our all our businesses, and we're in support of phase 1. I could go that far. But I also think the towns would need.
Okay, why don't we go ahead and send our suggestions to Craig and Marty, and we can come up with a draft and then we can adjust it from there. Why don't we start with that?
I think that's a good way to begin, just because we're kind of circling. We're not going to get anywhere.
Yeah. Yeah. Marty, do we need to have a consensus on that, or?
I think you have consensus right now.
Yeah.
To me, and where to go forward.
Okay. Okay, well then, why don't we move on to the next item, because it's going to be just as much fun as the last one.
Well, maybe not so much. This one is the CARES Act funding distribution. And I wanted to share with you some information about the CARES Act. The two town managers and I have been talking about where we are with the CARES Act and the funding. And just to give the board an update, the Commonwealth of Virginia is receiving $3.3 billion. The CARES Act that was passed by Congress, 200 million of that is earmarked directly for Fairfax County, because they're the only county in Virginia that was over 250,000, I believe it was, that qualified for that direct allocation. That leaves 3.1 billion coming to the Commonwealth directly. Of the 3.1 billion, they've announced that they're going to distribute 650 million to localities based on population. The remaining 2.6 billion, I believe it is going to be held by the state at this point in time. One of the concerns that's been expressed is that these funds can only be used for COVID-related expenses. They currently, the way it was written, cannot be used to offset any revenue losses for localities. Mark Riddell in Blacksburg and I and Randy in Christiansburg have been talking. It looks like if that 650 million that's going to localities, if they base it strictly on population, that will result in Montgomery County getting approximately 7.7 million. The other interesting thing about the way they're allocating it is the state is only allocating it to cities and counties. They're not allocating it to towns. So the dollars that would be coming to Montgomery County would have to be allocated by Montgomery County to the two towns. The state's not taking on that role. So that's the update that I have on the dollars. I know that Chair Fidjakowski, I know that there was a conversation last week, I believe, with one of the legislators. You told me about this issue.
Yes.
So that's all I have as far as update, but would certainly open it for discussion with the board as to your thoughts.
What is it that you're looking for? What feedback are you looking for?
Well, actually, I didn't ask for this on the work session. It was requested by Chair Fidjakowski. So that was just an update on the CARES Act.
But we don't know how much money at this point.
Yeah, so.
County, and then we need to know the parameters of what we can really spend it on, correct? So until we know those things, and then we would need to know what the two towns have spent money on that's related to COVID-19. So until we have that information, how can we really do anything?
Chair Steve. So my suggestion was.
Yeah. Go ahead. Can't hear you.
Okay. So my suggestion or what I was thinking of doing is, because we are in a unique situation with Virginia Tech, and it's our major, one of our major economic engines, and the towns are going to be devastated because I do believe 46% of the revenue from the sales tax, lodging tax for Christiansburg, and about 39% of the revenue for the town of Blacksburg. So my idea was, or suggestion would be, if we could, with the towns,
do a letter to Secretary Lane explaining our unique situations with Virginia Tech and the possible loss of revenue for the towns, just to make sure that we would get support for that funding. And also along the lines of having support of our local, our legislators as well, and even incorporate the business to advocate, just that they don't forget about us in Southwest Virginia. And so I thought that that would just be one way just to make sure that we're just advocating and the reasons we would need that money.
All right, I heard you say something about funding for loss of revenue, but that's not what this is for.
Right. Well, Chair
So
Fidjakowski.
this is in addition to?
Chair Fidjakowski, could we go from supervisor to supervisor like we've been doing for the other points of discussion?
Sure.
Thank you.
Yes, we can do that. Supervisor King?
I don't know.
Thoughts on the letter to,
I'm not sure if Sherry's finished yet.
Yeah.
So what I mean is
okay, sorry.
the towns are not going to get that money separately, so it's going to come to us. So I just would like to advocate and thought we would be a voice with the letter of making sure we got those funds, this locality.
Okay. Supervisor King?
I know, Craig, you haven't got any depth of it, so you probably don't know the answer, but if we get $7.7 million, have they give you any figures how you got to split it with the two towns?
No, and they haven't said for sure that they're going to use per capita to split the 650 million. The managers are assuming that that would be the formula and that's how it would come. But again, that money can only be used for COVID-related expenses. And honestly, right now, we don't have $7.7 million in COVID-related expenses. So then it becomes a question of, does that money go back to the state? The point that Supervisor Blevins made is, it's a lot of money and we really need to encourage them to get as much clarification as they can. I read something earlier this evening that there's really starting to be talk at the federal level about maybe some of this should be used a little more broadly, but that's not how they passed it. So we've got to communicate back up the line to folks that, 7.7 coming to Montgomery County would be great if we qualify to use it. If we don't, then I'm not sure what benefit.
But that's what I was gonna say, there's talking in DC about going back and redoing the law that they just passed.
Yes, sir.
Because they're saying a lot of localities is, thank God not for us, but a lot of localities have to lay off and furlough their employees. And they're wanting to use some of that to bring them back.
And the way the law is written right now,
You can't do it.
You can't.
But I was just wondering, because we got two towns, if we get 7.7. Right now, I think we're just talking before we know what's going on. Thank you, Chair.
Okay, Supervisor DeMott?
I completely agree with Supervisor King. Right now, we're talking and we don't really know what's going on. I would feel comfortable with maybe receiving some updates on this in advance of our next meeting. Maybe if any new information comes forward, any updates in what kind of funding we're getting, if the CARES Act is expanded to include a broader scope of uses for the money. But right now, I'm not really, I don't really know what action, if any, we should take besides to be vigilant in monitoring this, because it clearly is very impactful to our community, but we just don't know yet, if that makes sense.
Okay, Supervisor Biggs?
Yes, we're gonna have to come back and revisit it as as I guess they come out with the way it can be implemented. I think that's still something that needs to be looked at.
Okay, Supervisor Shepherd.
Agree with April and Mary. I think we just need to wait and see what the details are and how much we're getting, and you know, if the stipulations change. I just sitting here thinking about it. I didn't think we'd spent that much, but yeah, I think we need to wait.
Okay. Vice Chair Bone.
Is there a list or are there definitions that we know right now, items that would qualify under the present definition?
Yes.
But you're saying that there isn't nearly enough expense to warrant the $7.7 million under the present definition.
That's my understanding, yes.
Are we asking to write a letter for further clarification? Is there any use in doing that? Or is it just as well we wait until the changes happen? Does anybody know that answer to that question?
I really think it's still being legislated.
Mm-hmm.
It is.
Yeah, I mean, I think it's such a, I don't know kind of situation.
Okay, so I'm assuming that the FEMA dollars that we're getting supposedly for our task force and all the testing is not part of the $7.7 million. Okay.
No, ma'am.
What about the taxes that we may not get on June 5th?
There's no program established to cover that.
Okay, those are just my questions. Thank you.
Well, the only thing I didn't hear, Craig, did they say when that money would be available?
No, they have not defined when it will be. They only announced Friday about the $650 million that was going to be distributed to the localities, and that further details would be forthcoming. The $7.7 million is not based on anything other than the managers discussing if they distributed it on a per capita basis, that's what we would receive. But I do not know, and I don't know yet that they know how they're distributing it.
All right, well, your report on that money has answered all the questions I had, which is the reason why I wanted to put it on the agenda and wanted to consider sending a letter to find that information. But since you've already satisfied that, I don't really see a consensus to send a letter out in this particular case, unless somebody has something else.
Mr. Chair, I was going to report this under my board report, under my county administrator report, but I can tell you that in the local government managers call that we had this afternoon, that we have 3 times a week, we had Delegate Rush, Delegate Hurst, and Senator Edwards on that call today, and we talked about the very issue that I just brought up as far as the $650 million being allocated to the localities and encouraging them to provide guidance as soon as possible, and encouraging them, which then they encouraged us to reach out to our federal delegation as well, because the federal folks are the ones who wrote the law on how the money goes, and they're the ones that are going to have to determine if there's changes. But that being said, we still encouraged everyone on the call to please keep this moving forward and help us find ways to address some of these shortfalls that we know we're going to be facing.
Well, in light of that, I'd say the people we should be sending a letter to would be the federal government, requesting that they expand the use of that money so that we can apply it to areas that are desperate for that money instead of just COVID-19 expenses. But we can consider that at another time, I reckon, since we don't even know when the money's coming. So anybody else want to comment on that?
We'll certainly keep.
All right, so we don't really have, yeah, go ahead.
I was just saying, we'll certainly keep you posted as we get more information.
Okay, that sounds good to me. So that pretty much rounds out our work session. Do we have a motion to come out of work session?
Motion.
Second.
We have a motion and a second. Secretary, would you please call the roll?
Ms. Biggs?
Aye.
Mr. Motts? Aye. Mr. Shepherd?
Aye.
Blevins?
Aye.
Mr. King?
Aye.
Ms. Stone?
Aye.
Chair Guzekowski?
Aye.
7 ayes.
Okay, next we have old business.
Mr. Chair, first item under old business is an ordinance to re-adopt the ordinance dated March 23rd, 2020 to effectuate temporary changes in certain deadlines and to modify public meeting and public hearing practices and procedures to address continuity of operations associated with the pandemic.
Okay, do we have a motion for that?
Motion.
Second.
Okay, we have a motion and a second. Any discussion? Hearing none, Madam Secretary, will you call the roll?
Mr. Motts? Aye. Mr. Shepherd?
Aye.
Blevins?
Aye.
Mr. King?
Aye.
Ms. Stone?
Aye.
Ms. Biggs?
Aye.
Chair Guzekowski?
Aye.
7 ayes.
Mr. Chair, next item under
Next
old.
item in old business.
Yes, sir, is the VDOT 6-year secondary road improvement plan. This is a resolution to adopt the 6-year secondary road improvement plan. We had the public hearing on this a couple of months ago. We've had quite a bit of discussion. Since that discussion, we've become aware of other roads that have been brought up by citizens. And my comment to you on that is we'll probably do another road viewers tour in the couple of months. If we can all be in the same vehicle, we'll have to figure that out. But when we do a road viewers tour, we'll look at some of the other areas that have been brought up. The challenge with the 6-year road plan is, as you well know, some of the roads that are further down the list, it's a challenge to get the list done in 6 years. But this is the best effort based on VDOT's input and the board's input. So I would recommend approval of the resolution.
Okay, do we have a motion?
Motion.
Second. Ping pong.
We have a motion and a second. Any discussion? Hearing none. Madam Secretary, if you call the roll.
Mr. Shepherd?
Aye.
Blevins?
Aye.
Mr. King?
Aye.
Ms. Stone?
Aye.
Ms. Biggs?
Aye.
Mr. Motts? Aye. Chair Guzekowski?
Aye.
7 ayes.
All right. Next up is new business.
Yes, sir. First item under new business is the resolution establishing the fiscal year 2021 budget. I'd just like to say I appreciate the board's patience with us on this one. This was not an easy resolution to write. I think in my career and in Carol's career as well, we've not ever had a situation quite like the one right now. And so the resolution has a lot of qualifiers and whereases. However, we do recommend that the board move forward with the adoption of the budget of $209,326,807. The board's previously adopted the tax rates for the upcoming year. This resolution does signify the funding or the spending amounts that are being held in reserve by the county related to various items of personnel and capital. It also signifies the funding that's held in reserve for the schools related to the additional funding for the school operating fund, and also related to sales taxes from the state. There's a letter attached in your packet from the school board where they discuss those funding reductions as well, and consent funding deferrals and consented to those deferrals as well. So we agree that we're working together in uncharted times, but and I think Mr. Krantz is still here, but we would recommend that the board move forward with the budget resolution as presented.
Do we have a motion?
So moved.
Second.
We have a motion and a second. Do we have any discussion? Well, I'd like to say, I think it's, these are very strange times we're going through, and I think it's great that the school board and the county administration and the board of supervisors are all working together. I think that's what it's going to take.
Thank you.
Madam Secretary, if you want to call the roll.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Ms. Bone?
Aye.
Ms. Biggs?
Aye.
Ms. Motts?
Aye.
Mr. Shepherd?
Aye.
Mr. Kowski?
Aye.
7 ayes.
And Mr. Chair, I'd just like to thank Carol and Angie and the finance staff for all their work to get us to this point. Honestly, the work's not done yet. We know that the coming months are going to present additional challenges, and we'll be watching the numbers closely, and we'll be coming back to you if we see any concerns.
Okay, let's move on to our next item. Ordinance to waive penalty and interest for 90 days on the 2020 real estate taxes due on June 5th, 2020.
Motion.
Second.
We have a motion and a second. Do we have any discussion? Hearing none, Madam Secretary, if you'll call the roll.
Mr. King?
Aye.
Ms. Bone?
Aye.
Ms. Biggs?
Aye.
Ms. Motts?
Aye.
Mr. Shepherd?
Aye.
Blevins?
Aye.
Chair Chakowski?
Aye.
7 ayes.
Okay, we're moving on to reports. County Attorney.
No report, Mr. Chair. This late hour.
All right, move to our County Administrator.
Just one additional comment to what I made earlier. I did mention the managers had a Zoom call with Delegate Hurst, Delegate Rush, and Senator Edwards this afternoon. Also Friday, with the task force meeting, Congressman Morgan Griffith attended and got a briefing from everyone on the activities of the task force. He also then toured the testing site that afternoon, and we also had the commander of the Virginia National Guard attend the testing site and view that as well. So we're getting a lot of attention from a lot of places right now, which is really good. And we're hopeful that funding will continue to flow down, and we're hopeful that we'll be able to secure some other funding to patch some other holes. That's all I have.
Okay, thank you. All right, we'll go down to Board of Supervisors. We're going to start this time with Supervisor Biggs.
I don't have a report because the airport is going to meet tomorrow. But I would like, I think you guys have a county school liaison meeting tomorrow, so I would like to pass on to that group that, the school side anyway, how very appreciative we are of all the work that the teachers, I know it's Teacher Appreciation Week last week, everything that has been done by the employees of the school system. It's just been remarkable. And I would personally like to pass that on to them and just tell them how thankful I am for it and for everything that they have done for our students in the county.
Okay, thank you. Supervisor Demots.
No report.
What?
What?
Supervisor Demots, I couldn't hear you.
Yeah. I can come up with a report if you want me to.
Okay. Supervisor Shepherd.
No report.
No report is good. Supervisor Blevins.
I'd just like to echo the same as Supervisor Biggs to all of our teachers. We're very appreciative of all that they've done, especially with this new uncharted waters that we're going through. Very appreciative of all the teachers and all that they've stepped up to do. Also want to just say how thankful I am this week as we celebrate National Law Enforcement Week, and would like to thank you, Chair Christiansburg and Supervisor Shepherd, for your service in law enforcement, and to all the brave men and women out there. We greatly appreciate and support your service each and every day.
Thank you. Supervisor King.
I would just like to thank the citizens of Montgomery County for their patience with us as we work through this unprecedented thing. And I do want the staff here at Montgomery County and the town of Christiansburg and the town of Blacksburg to know that I do appreciate all their hard work. If it wasn't a team effort, we couldn't get it done. And one more thing, while everybody's sitting at home, please fill out the 2020 census.
Yes.
Because that adds to our funding.
Yes.
That's all.
Okay, thank you. Vice Chair Bone.
I'd like to concur. I think the county staff has done a remarkable job considering all the different challenges that we've had. I think that the task force is amazing and deserves all the attention, and the county and towns deserve all the attention that they're getting because of their remarkable rallying for this pandemic. I also want to thank again the first responders, law enforcement, and all the essential workers. If it wasn't a team effort, we wouldn't have 4.5% rate. So that's a great indication of how we've all worked together, and I can't thank you all enough.
Okay, thank you. Well, I can't believe you all left me a half an hour to give my report. But I'll try to fit it into a half an hour. Yeah, I have to agree with my fellow supervisors. We live in a remarkable area. I've never seen so many dedicated people working so hard for everyone. And it's really, it makes you proud to be from Montgomery County, that's for sure. And we definitely appreciate our own administrative staff and all the hard work they do every day, that every time we ask them for something, they usually find a way to get it done. And that's very much appreciated. And that's really all about I gotta say. So we might have to go home early tonight. If we have no more items, I call this meeting adjourned.